Meeting of the Mental Health Services Oversight and Accountability Commission. My name is Mara Madrigal Weiss, and I am the Vice Chair of the Commission, and in the absence of a chair, I serve as the acting chair. We want to thank you for attending the meeting and for being here to participate in the important work that is being done. As many of you know, the governor recently made 2 new appointments to the commission. I want to welcome Commissioner Mark Bontrager and Commissioner Alfred Rolette to the commission and their first meeting. They replace former commissioners Lynn Ashbeck and Ken Barrick, who each contributed great vision and leadership to the commission's work. We will honor our former commissioners Ashbeck and Barrick at a future meeting, and hopefully we will be able to do this in person. Commissioner Rolette is filling the role of mental health professional, and Commissioner Rolette has been Chief Executive Officer of Turning Point Community Programs since 2014 and is a member of the National Association of Social Workers. He also serves on the board of California Institute for Regenerative Medicine. Commissioner Bontrager is filling the role of Healthcare Service Plan Provider or Insurer and comes to the commission from the Partnership Health Plan of California and serves as Vice Chair of the Napa County Workforce Investment Board. I would like to invite Commissioners Bontrager and Rolette to say a few more words about themselves. And hopefully I pronounced your names correctly, and if not, please let me know now. Please, I invite you to share a little bit more about yourselves.
I'll go first, I guess. Mark Bontrager with Partnership Health Plan, as you indicated. I've been with Partnership about 4 years now. Prior to that, I ran a nonprofit mental health program and foster care program. Professionally, in my history, I'm a social worker as well as a previous lawyer. So I kind of come to the commission with about 30 years of experience in the mental health arena and in different aspects and in different capacities. But I really look forward to participating on this commission and learning and listening. So I appreciate the opportunity.
Thank you so much. We're happy to have you here. And Commissioner Rolette, are you here?
I don't think we see Commissioner Rolette yet.
Thank you, Tom.
Yeah, he's delayed in joining us this morning, Madam Chair. We'll let you know when he can join.
Thank you so much. I don't know why I put myself on mute. Thank you so much. I'm not used to continue talking. Okay, so before we get started, I just want to say how much I've appreciated the leadership of former Commissioner and Chair Lynn Ashbeck. For more meetings than I can count, I have watched her facilitate the commission's process with exceptional grace. As I step in as acting chair, I ask for both your forgiveness and your patience if I make mistakes. As I fumble through this morning, there's so much to pay attention to in running these meetings, made more challenging by the fact that this is a video meeting. I just really want to take the time to thank Lynn for being such a gracious model and thank everyone here as I learn this new role. I also want to thank Pashi Walker for their request to strengthen the commission's understanding of pronouns and misgendering. I have asked staff to explore opportunities for trainings, and we are committed to doing better with using pronouns correctly. Pashi provided some suggestions, and we are exploring these recommendations, and we will work with our partners to improve our practices, including exploring ways that we can incorporate pronoun training into our schedule. I'd like to reiterate at this time a main point mentioned at the beginning of the previous training. The Commission's strategic plan for 2020 through 2023 is committed to 3 strategic goals and objectives to advance the Commission's vision of well-being for all Californians. Cody, please share with us this meeting's agendas, items that support the Commission's strategic plans. Thank you. So just so that we are all grounded there, we want to make sure that just, again, to ground what we're doing, place us there so that as we move forward, we want to always be able to go back to our purpose, what our goals are, and everything that we're doing. Thank you so much, Cody. So our announcements for this morning, we have several of them. I'd like to begin with, there will be no commission meeting in December. Regularly scheduled meetings will continue in January. Also, the October 2021 commission meeting recording is now available on our website. Most previous recordings are available upon request by emailing the general inbox at mhsoac@mhsoac.california.gov. Through the executive director and the chair's delegated authority, 2 county innovation projects were approved. Cody, please share the slide reflecting those approvals. Thank you. So Monterey County and Lake County were both approved. The details are there. You should also have them in your handouts. Just so we take a look. And thank you, Cody. Additionally, staff changes. I would like to invite Brian Sala, Deputy Director of Research and Chief Information Officer, to welcome new staff joining the commission.
Thank you, Madam Chair. I'm pleased to introduce to all of you Dr. Callie Clark, who is the Senior Research Data Analyst in our Research and Evaluation Division and is the new lead for our summative triage evaluation project work. Dr. Clark is a social worker and educator by training. Her research brings together social work and education research to examine how policies and practices drive inequalities in higher educational attainment. She received her PhD in Social Service Administration from the University of Chicago, where she was an Institute of Education Sciences pre-doctoral fellow. And she comes to us directly from Temple University, where she was a senior research associate, conducting evaluations of interventions and policies aimed at reducing basic needs insecurity, such as access to food, housing, and mental health services, all very relevant for the triage programs, which really focus on reducing criminal justice involvement and hospitalizations. Her research has been the focus of numerous media outlets, including New York Times, Washington Post, Forbes magazine, and she was also formerly a host and producer of a podcast called Separate and Unequal Education in America. So welcome, Dr. Clark. Thank you, Madam Chair.
Thank you, Brian. Welcome. We're happy to have you. Thank you for joining the team. We'd like to move on. If anyone is interested in making public comment regarding the announcements or miscellaneous materials, please make those during the general public comment time. Commissioners, if you leave the teleconference meeting for any reason and decide to rejoin, please make sure to use the raise hand function so commission staff can make you a co-host again. If you have a comment to provide, please unmute your line and seek recognition when it is convenient. Lastly, if you have any technical questions, please contact Lester. And at this time, I want to ask Amarani to go over the public comment procedures.
Actually, Mara, if I can interject, may I make a brief update regarding the Research and Evaluation Division and Committee?
Yes, absolutely. Please do.
Okay, thank you. I don't have much to report. As you all know, we have initiated a search to fill the position of Chief of the Division, which is really critical. At the same time, staff, Brian, and staff that report to Brian are working hard to continue the work that the division is responsible for. 3 new staff were brought in to lead the triage summative evaluation. And in addition, staff is developing a proposal, including addressing the staffing needs and resources to be able to evaluate the MHSSA, which is a requirement for us. There's also ongoing work in the data infrastructure space, gaining access to databases and linking databases. So those databases can be interrogated and we can develop insights that inform our actions. And we're going through a process of trying to sort of connect and map our goals and objectives to our resources so that we can figure out and prioritize our efforts in terms of what initiatives we should pursue and how we can ensure that we're being effective in them rather than taking on so much that we can't quite get everything done. The next Research and Evaluation Committee meeting is scheduled to be January 12th. It will be more of an informational meeting because we are in a state of transition, but hope to have more information for you and to get up and running again with the committee soon.
Thank you, Commissioner Danovich. Thank you for that update. Yes, Commissioner Alvarez, an additional update, please.
Yeah, just really quickly, thank you, Chair Madrigal-Weiss. Following up on Commissioner Danovich's comments, I just wanted to give a brief update on the Cultural Linguistic Competency Committee. I want to thank the members of the committee and members of the public that were able to join us most recently in our November meeting. We had a robust discussion about our racial equity action plan and how the committee can contribute to its success. We also discussed the Immigrant and Refugee Stakeholder, RFA, as well as the triage, RFP and the triage RFA, and really had robust discussion with our committee members and members of the public about how to operationalize racial equity in those spaces, and really appreciate the contributions that committee members made to those discussions, as well as members of the public. We have our last meeting of the year on December 8th from 3 to 5 p.m. And we're excited to not only continue the discussions from this last meeting, but also add to the agenda discussion around prevention and early intervention. That was the request from committee members, and that we know many folks in the public are anticipating. So looking forward to that and want to make sure people have a heads up that that's coming given the upcoming holiday. So see you on December 8th. Thank you.
Thank you, Commissioner Alvarez. And I will provide an update on our subcommittee for PEI. We continue to work on updating the drafts of the report, and we are looking to host a subcommittee meeting into the new year. So we will share that with you. Again, there will be plenty of time to review and update, and we will host those meetings as soon as we get them scheduled. So we're looking to work on this early into the new year. So that is where we are with the PEI committee, and stay tuned. We will get more information out to you before the end of the year so that we all have plenty of time to come together and discuss that. So thank you. I know I went a little off, but it's all good stuff. So here we go. All right, so I will have Amirani, please, if you could share with us the public comment procedures.
Let's see here. All members of the public will have the opportunity to offer comment at this public meeting as described in the agenda. We appreciate your patience and understanding as we learn and adjust to improve these virtual meetings. We welcome your comments. Public comment.
Amirani, I'm so sorry. I'm
Yes.
sorry. I missed Commissioner Bunch did want to provide an update, so I'm sorry. I'm
Oh,
gonna
okay, no worries.
press pause. I didn't catch it. I apologize. So Commissioner Bunch, you wanted to provide an update? I'm sorry, that was Commissioner Alvarez. You did provide the update. I'm getting my communications. Okay, please continue. My mistake. This is where I asked for forgiveness early on. So please, thank you, and let's move forward. Go on, Amirani.
Okay. All right. So public comment will be heard for each agenda item. Please listen carefully as I go over the public comment procedures. If you would like to comment on an agenda item, please wait until that agenda item starts. You may request to make public comment by clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. You will be placed in a queue to comment on that agenda item. When it is your turn to comment, the moderator will unmute your line and announce your name or the last 3 digits of your telephone number. When you are unmuted, we are able to hear you. We will do our best to take comments in the order they are received. Please note, once the public comment period for the agenda item starts, we will close the public comment queue. The moderator will insert the word "last comment" next to the commenter's name or number to identify the last public comment. So please make requests to comment as early as possible. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. When we have reached the end of your time, our staff will let you know, but we will let you finish your thoughts. This is easier when we can all see the clock. We don't want to cut you off, but we do need to maintain time limits. We appreciate your understanding with this process. Lastly, if there are any members of the public using translation technology, Please notify the chair, and at least twice the amount of time will be given to you during the public comment period. Also, I would like to mention that a live meeting transcription or closed captioning is available for public members needing special accommodations. If it is not currently visible, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. Chair Madrigal-Weiss, I hand it back off to you.
Thank you so much. So if we could please move forward with our public comments.
Okay, we have 3 or 4, no, we have 5, okay, one moment. Okay, the first public commenter is Andrea. Your line is open. You may go ahead.
Hello, good morning. This is Andrea Crook with Cal Voices, and I just wanted to comment on the lack of transparency regarding the governor appointments. I don't have anything planned because I was surprised that Ashbeck and Barrick are removed from the commission. So I'm a little taken aback. I don't have anything planned because I thought they were going to be at this meeting. I see that they are still listed as being on the commission, as well as being listed as being chair of some of the your committees. The other thing is that there's a lot of commissioners that have been on here for many, many years who rarely come to the commission meetings, or when they do come, they come just to ensure that there's a quorum and then shortly leave. And I felt that with Ashbeck and Barrick, we had consistency. I also know that there's a lot of individuals that have a lot of experience with behavioral health across the state that have applied to be on the commission and have not heard back regarding their applications. So I'm just wondering what the process is for selection and just requesting that it be more open to the public. Thank you.
Thank you, Andrea.
Excuse me, Chair. I believe we need to take the roll before we proceed with public comment. Sorry, can you hear me?
Yes, I'm sorry.
I believe we should take the roll first so that we can all be on the record.
Okay, please, yes, let's do that. I apologize. I had that afterwards.
That's fine. All right, I'm about to take the roll call. This is Chief Counsel Maureen Riley speaking. Vice Chair Madrigal-Weiss, Acting Chair.
Here.
Commissioner Alvarez.
Here.
Commissioner Bontrager.
Here.
Commissioner Boyd. Commissioner Boyd. Okay, Commissioner Brown. Commissioner Bunch. Commissioner Cannavale.
Here.
Commissioner Carrillo. Commissioner Carrillo. Commissioner Chen. Commissioner Chen. Commissioner Cortese. Commissioner Cortese. Commissioner Danovich.
Here.
Commissioner Gordon.
Here.
Commissioner Mitchell. Commissioner Mitchell. Commissioner Rolette. Commissioner Rolette. Commissioner Tamplin.
Here, and I see Commissioner Mitchell trying to unmute herself to
Aha.
say she's here also.
All right, if we can see her, I'm going to count her. Okay,
I'm here. I was not allowed to unmute, so I'm present. Thank you.
thank you. And Commissioner Wooten. All right, I'm just going to come back briefly to Commissioner Carrillo. Commissioner Chan,
Present. I
Uh-huh.
have unmuted successfully as well.
okay. And Commissioner Cortese? Okay. Well, we have a quorum. We may proceed.
Thank you so much, Marie.
Okay. Okay, I'm having a hard time seeing everybody. Commissioner Bunch, Kendria Bunch, I think you're on mute, but I'm going to count you.
And I also see Commissioner Carnevale sitting with Director Ewing.
Here.
Aha. Okay, excellent. I'm going to count Commissioner Carnevale. I think I have his name. Okay. Okay, we still have a quorum. Even better. Thank you.
Thank you so much, Maureen. So Amarani, if we could please continue with the public comment.
Okay. Next we have, okay, Pashi, your line is open. You may go ahead.
Good morning, commissioners. This is Pashi Walker. Pronouns are Z, zers. I had a different public comment that I had wanted to make, and so I want to ditto what Andrea Crook just said, that I am shocked. I thought Commissioner Ashbeck would be here based on what the agenda said. I would like to thank the commission for their timely response to my public comment regarding pronouns at the last meeting. I would like to point out that Commissioner Ashbeck was the one who privately reached out to me and asked me to provide some recommendations and suggestions, and I did send those to her, thinking she was still chair, at least for this meeting. So thank you for that. But I also want to point out that if I'm looking at this correctly, there is now no representative for the Central Valley. And I realize that in law, there's representation that's required in the act, but in the act, we don't require racial equity, LGBTQ equity in terms of, or regional equity in terms of representation. But yet that is also very important to make sure that the needs of all our communities are being met. I'm deeply concerned that this was so sudden that we didn't even have it on the agenda. And I would like to echo the request that this process be made far more transparent and public, so that we don't lose active, meaningful commissioners without any explanation. Thank you very much.
Thank you, Pashi.
Okay, next we have Craig. Your line is open. You may go ahead.
Yes, my name is Craig Derrick. For those who are joining new, for 23 years, I helped write a bill in California with Gray Davis and Bill Lockridge. Is AB 1718 with Hertzberg, is on police training for autism and mental health. An editorial in the Times, you can find that. I was placed on record for Congress in 2003, fight for autism. I only have a short time. I have done a lot of field work. I'm very saddened to see our state compared to Utah. Not understanding. I was with the County Board of Education yesterday. I have no clue what screen time and SAFE is and blue glasses, and we're trying to do all our work towards this commission about what we know, and yet there's all kinds of my website, my letters, that I would encourage you to watch the movie on the agenda or your convenience. Screenager movie. Dr. Denny Rush has podcasts that will teach you all. Tweet. It's now the National Board of Counseling, and psychologists endorsed for one professional credit. If we're going to be about this commission, and I'm being frank now, let's get on board with the testimony in Congress is. Take this website and have Brian Sayers open his phone and staff and work with me so we can have on things on the agenda, because we're not making it from what I had done to deal with your body of your governments is not registering, and we're on a hypothesis everything's going to work because we're passing it on to the next person when they're not familiar with the logarithms and the testimony for pre-teen addiction, that we haven't understood this yet as to how to funnel those monies into ECHO therapy centers and things where the school in the county of Orange is one producing to help me Brian says that we Mark Lorenz, and they're shut down. I just think that we realize that there needs to be a form of understanding that there's culture and silos. And until we realize that we're going to have a lose a generation testify Congress, we may want to be in tune to my research and become familiar with the ground floor rules. And I hope you'll put this on the agenda for your children, entitled Digital Wellness and Safe Technology, and define it for your dollars where it's going. Because of the hours and 23 years of experience and 5 on research of this, and Brian knows me, and I wish he would unblock me, that maybe we can help our kids save a generation losing their lives. I'm really upset the way that things are going in our state and compared to Utah, compared to the Congress and other countries like Taiwan in 2010. They banned the screen time, and China and in blue light. Well, we're going to realize we're in a war for the mental wellness of our children, and we as a commission should be in tune to this. I don't think we're going to win it this way. I wrote a white paper. I asked you to review it. It's well done. It's 18 points. What ecotherapy, other forms of therapy we should be funding in parks, and we don't have enough funds in the park. Thank you.
Thank you, Craig.
Stacy, your line is open. You may go ahead.
Good morning, Commissioners. Stacy Hiramoto, she, her, hers, Director of REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I too am shocked by the sudden departure of the commissioners. I was hoping that perhaps that Commissioner Ashbeck, who in my opinion, and I've been to, as I like to tell people, like probably over 90% of the commission meetings that have ever been held, she's one of the greatest chairs that we've ever had. And I was hoping that maybe that she could be brought back so she could receive the accolades from people that she deserves. Since I feel like that should be easy since this is a video meeting so far. But I would like to welcome the new commissioners, Commissioner Bontrager and Commissioner Rolette. Commissioner Bontrager, I am a social worker, a Pride social worker, and active member of NASW for many years. So I look forward to working with you. And I have known Al Rolette for many, many, many years also. And I really look forward to working with him. Moving on, I would like to thank Commissioner Alvarez for a robust meeting of the CLCC and thank her for acknowledging that on the agenda for the next meeting that the issue of the PEI priorities will be placed. And I want to make sure that that is clear, that it is the list of priorities that the OAC is to establish per SB 1004. That is the specific agenda item that is requested by Lee Lowe and Jim Gilmer, both members of that committee. They are asking for that because both REMCO and the CRDP have prioritized this, and we would like to see transition age youth who are currently not enrolled in college added to the priorities, as well as making clear that community defined evidence practices are also added to that list of priorities. So again, thank you, Commissioner Alvarez, for a good meeting, and thank you, commissioners.
Okay, next we have Josefina. Your line is open. You may go ahead.
Thank you, and good morning, commissioners. My name is Josefina Alvarado Mena. I'm the CEO of Safe Passages. We are one of the 35 implementation pilot projects of the CRDP. I also serve as the chair of the CRDP Cross-Population Sustainability Committee, and I'm here today to speak on behalf of the CRDP. We wanted to speak to the PEI funding priorities and to clearly articulate that this is one of the priorities of our initiative and our advocacy work. We were appreciative of Commissioner Alvarez's chairmanship and coordination of the Cultural and Linguistic Competency Committee meeting over the last couple of weeks. And the conversation that happened there. Our understanding is that SB 1004 passed in 2008 requires the commission to establish a new list of priorities for the PEI funding at the local level. And there are two specific issues that we would like to see addressed. One is, as Stacy previously mentioned, we want the traditional transitional age youth and want it to be explicit that that priority includes all transitional age youth, not just transitional age youth that are currently enrolled in college. And secondly, that the cultural competency language in the PEI regulations be strengthened, and that the existing language has not been strong enough to address the issue of racial, ethnic, and LGBTQ plus disparities in terms of mental health. If that language had been stronger, we believe we would have seen greater reduction of disparities within those target populations. And we have not seen that. In fact, we have seen the opposite of that. And the impact of COVID-19 has exponentially amplified, as I have said previously, those disparities in these really important communities. And so we would like to see added to the PEI regulation languages, the integration of community-defined evidence-based practices. We've talked a lot about this over the last 2 years. We need to do things differently if we want to reduce disparities. And this is one way that is now proven to be effective in terms of addressing the mental health needs of these communities. So please consider those two additions to the PEI language. We will be engaged in this conversation as it moves forward, and we look forward to partnering with you on this particular policy work. Thank you.
Thank you.
Okay, next we have Hannah. Your line is open. You may go ahead.
Hi, good morning, commissioners. My name is Hannah Bickoff, and today I'm speaking on behalf of Cal Voices. Myself, fellow colleagues, and community members have spoken to you before about a statewide innovation project called Help at Hand. This is a $100 million project over the span of several years that is being severely mismanaged. As part of our advocacy efforts, Cal Voices has tracked this project since its inception. We have warned the implementing bodies of the risks of irresponsibly testing tech apps on the severely mentally ill. We have asked the chair, commissioners, and the executive director to address these concerns and have been continuously dismissed. Today, I would like to share a few additional statistics Cal Voices has compiled through a very recent California Public Records request on the Help at Hand project that illustrate why we believe that this issue warrants immediate attention and a massive overhaul of funding and services. Number one, between January 2021 and May 2021, $132,506.85 was spent on 501 cell phones that were intended to be disseminated to consumers of the public mental health system. Cell phone records reveal a maximum of 20 of the 501 active lines are actually being used. However, this shouldn't be too surprising to commissioners, given that an evaluation report from UC Irvine from September 2018 to December 2019 revealed that, quote, they should not have moved into phone contracts. We are paying every month for phones that sit in boxes. Number two, speaking of evaluators, our PRA request also revealed that at least 5 separate evaluating bodies have been contracted for Help at Hand, including UCLA, UC Irvine, Cambria Solutions, WISA Inc., and CIBHS. However, we still do not have any data related to the total number of individuals served by participating counties and across the state, and more importantly, the impact of tech apps on mental health outcomes among the severely mentally ill. And lastly, for purposes of time, I'd like to mention a $1,500,000 contract, potentially more, with an app called MindStrong that has failed in multiple counties, some of which have now exited the Help at Hand project. With the understanding that innovation projects are exploratory in nature, I asked the commission, at what point is it determined that a particular intervention is not meeting consumer need and must be terminated in order to fund more effective and successful services? I truly hope the commission finds the time to investigate Help at Hand and honor their commitment to community stakeholders. Thank you so much.
Thank you, Hannah.
That was our last official public commenter, but we had 2 more come in after the fact. Would you like to take those?
Yes, please. We'll take the 2.
Okay. Next, we have Michelle. Your line is open. You may go ahead.
Thank you very much. Thank you, Commissioner Myra Alvarez, for elevating this topic, and thank you, commissioners, for taking our passionate comments. My name is Michelle Laplace Watts, pronouns she, her, hers, and I'm Catholic Charities East Bay Mental Health and Violence Prevention Manager and clinician, working with staff in one of the 35 CRDP projects that supports, in our opinion, prevention and early intervention for BIPOC and LGBTQ youth. We work in a middle school and 2 comprehensive high schools in Oakland. We work with trauma surviving youth from under-resourced and underserved communities in Oakland. The pandemic, as my colleagues have stated before, has exponentially exacerbated the pre-existing traumas and lack of equity in services that BIPOC and LGBTQ communities survive. As culturally relevant providers with common system, historical, and pervasive racialized and other identity trauma experiences, as our youth, we are uniquely poised to support. Community knows how to heal community. We're asking that you redirect PEI funding to our community-defined evidence-based practice programs. Our programs have collected data for over 5 years that demonstrates the effectiveness of our models of service. Our youth show marked improvement in capacity to self-regulate, solve conflict, and their PTSD symptoms reduce dramatically. As others have stated prior to this, we are asking that PEI priorities be on the agenda for the next CLCC meeting on December 8th. We also make a request and would further like to elevate eagerly and anticipating the subcommittee's report on new PEI funding priorities and hope for it to be released very soon. Thank you again for your time listening to our comments. We appreciate the opportunity.
Thank you.
Okay, and the last public comment is Laurel. Your line is open. You may go ahead.
Good morning, commissioners. Good morning. I'm under the weather, so I'll keep it brief. I would like to especially support what Stacy Hiramoto has stated and what Josefina has stated. I'd like to just give a brief example of why youth who are not in college should be supported with to the maximum in the PEI priorities. Sacramento County, where I'm based with Muslim American Society Social Services Foundation, will be receiving approximately 6,700 Afghan refugees between last July and next July. A large number, probably the majority of those, will be children, of course, of different ages. But as those children grow up, they are often going to be delayed or maybe have breaks in their attempts to go to college if that's their focus, or if they want to go to the trades, they may not go to college at all. But their mental health needs will be great because of the trauma they've had of living in Afghanistan, fleeing from Afghanistan, and then being resettled in the United States. And so we know that PTSD is best treated early on for the best results. And so for what reason, I just can't imagine we would delay a person's treatment because they're not in college. I've heard this, I've been making this statement, and Stacy has, and many of us has, but nobody's ever said, why deny this to youth who happen not to be in college? Thank you very much.
Thank you.
Okay, that was the last public comment.
Thank you so much. Okay. We appreciate all of your comments, and I did want to address the comments regarding our commissioners. I too was taken by surprise. This was a decision that was made. There was notification through the governor's office. As far as I understand, Ken Barrick and Lynn Ashbeck could not agree more with your comments, Stacy. Lynn Ashbeck was a brilliant chair and has done a wonderful job, and I have had the honor of serving under her. And so the notification went out through the governor's office, and in fact, both of their times had been expired. And so however that works and however the decisions are made, that that's, so we were also surprised. And having said that, I look forward to the new perspectives and the new lens that our new commissioners bring forward. So so we hear you, and thank you for sharing that, and thank you for the great passion around our commissioners who will be leaving us. And so with that, let's go ahead and move forward. Our item number 1 is approval of the October 28th meeting minutes. The commission will consider approval of the minutes from the October 28th teleconference meeting. Members of the public may request to make a public comment now on item number 1 by clicking on the raise hand button on your computer or the app, or if calling in by phone, push *9. Once the public comment period for the agenda item starts, we will close the public comment queue. So please make your request comment now. Commissioner questions or comments? Do we have any commissioner questions or comments regarding this item? I don't see any, so if anybody wants to say anything, because it's hard for me to see, don't see any from my fellow commissioners. All right, are there any public comments? Please raise your hand now as the queue will be closing.
It seems like we have one public comment.
Thank you.
Pashi, your line is open. You may go ahead.
Thank you, Pashi Walker, pronouns are ze, zers. And I just want to make a special shout out to the scribe or whoever it is that compiles the minutes. I want to personally thank them for their attention to detail in documenting my comments. And I would also like to let them know and everyone know that the recommendations I sent to Commissioner Ashbeck included options that would not put such a burden on the scribe to have to know everybody's individual pronouns, but a way to do it without using pronouns at all. And so I hope that we aren't burdening our scribes and our minute writers, but while we are still having gender inclusivity. So I want to thank you very much.
Yeah.
This is Commissioner Mitchell, Chair. I was going to, if it's okay, if I could comment on that, I was going to ask Pashi if Pashi noticed the changes that she had requested, because there was a lot of discussion about that. And we know that everything can't be verbatim, but I appreciate her for, Pashi, for recognizing the efforts that staff made, because that was a really big deal. And just thank you for acknowledging that. And I, what's going to follow up with you on that. That's all, Chair.
Thank you. I also want to share that Pashi, we do have those recommendations, and so we are taking a look at those. So thank you again for sending those to Lynn. She absolutely shared them with us, and so those are a part of what we will be looking at. So thank you, we appreciate that. And so I think we are ready to move forward.
Chair,
yes,
we have Commissioner Rollins is on the line and he would like to speak now. He was able to join us.
Yes, please.
Thank you very much. This is Al Roulette, and I'm thrilled and honored to be selected by the governor to be a commissioner. Auspicious beginnings often result in wonderful contributions and tremendous endings. And so I'm hopeful that my auspicious beginning will result in that. Thanks to the staff for helping me with the authentication challenges that we were experiencing on this end, and looking forward to making contributions and sharing a perspective that will advance the strategic plan for the Mental Health Services Act, OAC. Thank you.
Thank you, Commissioner Rolette. We're very happy to have you here. And I am acting chair at this moment, Commissioner Rolette, so excuse any fumbles you might see. So I'm just gonna smile and we're gonna keep this going. So welcome again, sir. We're happy to have you here. And so at this time, I would ask for a motion to approve the minutes from October 28th.
So moved.
Thank you, Commissioner Alvarez. And do I have a second?
I'll second.
Thank you. Lots of seconds. I got up thirds and fourths there. So, all right, we are good. And any additional comments or questions from our commissioners? I see none. I hear none. So Chief Counsel, please call the roll.
Maureen, I think you might be muted.
Thank you. I am muted. Not now. Okay. Commissioner Alvarez,
Aye.
Commissioner Bontrager,
Abstain.
Commissioner Boyd. Absent. Commissioner Brown. Commissioner Bunch.
Aye.
Commissioner Carnavale.
Yes.
Commissioner Calorio. Commissioner Chen.
Aye.
Commissioner Cortese.
Aye.
Commissioner Danovich.
Aye.
Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Abstain.
Commissioner Tamplin.
Aye.
Commissioner Wooten. Vice Chair Magical Weiss.
Abstain.
Pardon me?
I abstain.
Oh. The motion passes.
Thank you. All right, we will continue on now. Item number 2 is the election of the Mental Health Services Oversight and Accountability Commission Chair and Vice Chair. The Commission's rules of procedures require that the election of a new chair and vice chair during the last quarter of the calendar year. Similarly, when there is a vacancy for the chair or the vice chair, the Commission's rules of procedure require a vote to fill those positions within 60 days. I was in discussion with staff on the idea of postponing this vote until January to allow our new commissioners to connect with their new colleagues. And we have that option. If we are not able to make a decision, I will ask for your support to suspend the rules of procedure to take a vote in January. I would like to ask the Commission's Acting Chief Counsel, Maureen, to walk us through the process. So Maureen, if you could do that for us now, please.
All right. And Cody, can you begin to show my first slide so I can just have that assistance visually? All right, so again, this is for the election of the chair and vice chair for calendar year 2022. Next slide, please. All right. The term of office under the Commission's rules of procedure is for 1 year. And as Acting Chair Madrigal Weiss just said, the elections must be held no later than the last calendar year, the end of the end of the last quarter of the calendar year. So the end of December. Of course, we're not meeting in December. The new terms of office begin in January. And this is in the commission rules 1.3 and 1.4. Next slide, please. The importance of the chair and vice chair. If the chair is absent or that seat is vacant, the vice chair assumes all duties, such as acting chair Madrigal-Weiss is today. And should this situation continue, then a new election must be held in 60 days. If both the chair and vice chair are absent or the seats are vacant, then the commissioner with most seniority shall preside. That's just by way of background. Next slide, please. In this process, the chair will call for nominations. Typically, these come from the commissioners. At least one nomination per office. We are voting on the chair and the vice chair. If only one, we would still need to have the vote to ratify. And of course, the nominee must consent to run. There will be separate votes for each of the two offices. In other words, two motions, but the public comment can be combined. Next slide, please. And it's with other action items, there would be a motion and second. In other words, a motion for the chair and a second, a motion for the vice chair and a second. Each one would have discussion. Discussion could be combined or not. Public comment, again, you could have it separate, but it could be combined. Then following this, call for the vote on each motion, and the majority passes. Same as with other action items, at least 7 aye votes. All right, I'm just gonna show on the last slide what the form of the motions would be. A motion to nominate, insert the name for the office of chair during calendar year 2022. And separately, a motion to nominate, insert the name for the office of vice chair during calendar year 2022. Thank you.
Thank you, Marie. So at this time, I would ask any of my fellow commissioners if there are any questions about the process. No one has questions about the process. Okay. So then, yes, please, Katera.
Chair Madrigal-Weiss, I don't have any questions, but I do hope we can make a nomination. And I just, would like to nominate you, our vice chair, as our chair for 2022. You've been leading and been in the position for vice chair for the last 2 years and have been there to support and work with our former chair, Ashbeck, and your leadership, your commitment, and your inclusiveness in running these meetings and other committees also has been just really an inspiration and a model for all of us. So I'd like the honor to nominate you as our chair.
I'd like to second. This is Keandra.
Thank you, Commissioners Tamplin and Commissioners Bench. I need a little guidance here.
Well, okay, so if this is the motion on the floor, we have a second. At this point, is there any discussion?
I think this is Commissioner Mitchell. Commissioner Mitchell, I think it's appropriate. I would support the nomination.
If there is no further discussion, are we going to accept public comment prior to the vote? Is there any request for public comment?
There is not any public comment right now.
All right, having a motion, having concluded discussion, we have a second, then call for the vote would be appropriate at this time. I'll take the roll call. The motion before you is to elect Vice Chair Madrigal-Weiss as the chair for calendar year 2022. All in favor, tell me yes. All opposed, tell me no. I'm going to read the roster. Commissioner Alvarez,
Yes.
right? Commissioner Bontrager,
Yes.
Commissioner Boyd. All right. Commissioner Brown. Absent. Commissioner Bunch.
Yes.
Commissioner Carnavale.
Yes.
Commissioner Carrillo. Commissioner Chen.
Aye.
Commissioner Cortese.
Aye.
Commissioner Danovich.
Aye.
Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Commissioner Olet.
Aye.
Commissioner Tamplin.
Aye.
Commissioner Wooten. Vice Chair Madrigal-Weiss.
I accept the nomination and the votes, and I am thankful. I did want to say something. There's been a lot of soul searching around this. As you know, I missed the last meeting. I'm so passionate about this work. I have been working very closely with Chair Ashbeck and been the co-pilot, so to speak. And, I'm honored and I'm humbled by this. And in doing this in the last 2 years, I've learned a lot. And it's been a tough couple of years. And like many of you, I've been impacted. My work has, my family life. I've lost family members in the last couple of years, dealt with the issues of addiction in the home and experiencing mental health issues with family members. It's been difficult, pain-filled, and humbling, but it's also really awoken me to how important this work is. So for those of you who don't know, I support schools within the 42 school districts here in San Diego County, and I'm responding to mental health crises of our youth each and every day. So we know that the pandemic has taken its toll. We know it's lifted, all those things that have been front and present, especially, for our youth and our families of color, those living in poverty and those who have traditionally been marginalized. So I want to stand together with everybody here and with my fellow commissioners, because in all that we've seen that's been negative, we've also seen good and opportunities. I've seen cross-system partnerships and collaborations working with greater intentionality. And that, to me, I think there's great opportunity. I've also seen that this pandemic has really helped us move forward in stigma. So I realize that as grateful as I am, gratitude isn't enough, right? I know there's still so much work that needs to happen. And so I think about the Commission's work on school mental health, how groundbreaking it is, and the work on suicide prevention has really elevated the challenge that keeps me up at night when I receive those calls about our youth at risk. We've achieved so much in the past few years, even since I've been on board. And in partnership with Commissioner Alvarez, I am leading the Commission's work on prevention and early intervention. And when I talk about lead, it really is walking alongside. So we've been intentional, and we don't always get things right. I don't always get things right, but I'm glad that we're doing this together. And I really hope that as we work further along the PEI, you see that we're not trying to be prescriptive, we're trying to be responsive to all the needs of all Californians. So I thank you for this. I thank you, commissioners, for trusting me and for inviting me to this opportunity. I'm very much about the we, so I will be meeting with all of you because I want to see where you're going to fit in with me and hold hands with me and walk with me, because it's not enough to just lead these meetings. It's what happens in between. And I fall in love with everything. So I'm part of suicide and part of work in mental health and part of PEI. And so I really hope that we'll do greater things together. So, and honor, of course, those that came before us. Lynn is a model and a friend, and we have so much to do. So with that, thank you. So I accept. I think we got a little bit out of order, but here we are. So thanks so much, Maureen.
Thank you, acting chair and presumptive chair for the next year. For the record, the motion passes.
Thank you. Thank you. Do we go to vice or do we go to comment? I'm sorry.
Well, this motion passed, so I would suggest that we move to the next one and then we see if there's a comment on that one. And then if not, that would pass and then we could still have comment, but. So I would say the next item of business would be to call for a motion for a nomination for the office of vice chair for calendar year 2022.
So we will ask for a motion for vice chair. I see Commissioner Taplin, your hand is raised.
I know this is just such an honor to be part of this group and see the leadership of all our commissioners. And I feel like I'd like to nominate Commissioner Alvarez if she accepts as our vice chair. I know it's been a long time coming and her leadership is outstanding. And I think with both you, Commissioner Madrigal-Weiss and Commissioner Alvarez as our leadership, it's just exciting and an honor to be able to see you both continue to lead in this work.
I would like to second that motion.
All right, we have a motion and a second. Is there any discussion?
I would just echo the commendations for both Mara and Myra. We have an outstanding pair of leaders in those two, and I'm incredibly supportive.
I ditto that, Commissioner Mitchell.
All right.
Commissioner Gordon, I saw the box light up. I don't know if you wanted to say something.
Oh, I'm happy to echo it all. I think it will be an outstanding team.
Thank you, Commissioner Gordon.
Absent further discussion, we have a motion and a second. The motion is to elect Commissioner Alvarez to the office of Vice Chair for calendar year 2022. I will proceed with the roll. Commissioner Alvarez.
Thank you. Yes.
All right, I assume that's a yes. Commissioner Bontrager.
Yes.
Commissioner Boyd, absent. Commissioner Brown. Absent. Commissioner Bunch.
Yes.
Commissioner Carnavale.
Yes.
Commissioner Carrillo. Commissioner Chen. Commissioner
Aye.
Chen. All right, thank you. Commissioner Cortese.
Aye.
Thank you. Commissioner Danovich.
Aye.
Thank you. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Roulette.
Aye.
Thank you. Commissioner Taplin.
Aye.
Thank you. Commissioner Wooten, absent. Vice Chair Madrigal-Weiss.
Aye.
Thank you. All right, the motion passes.
I'm clapping for my, so thank you so much. At this time, let me see. Myra, did you want to say something?
Sure, I'd love to. Thank you, Chair Madrigal-Weiss, and thank you to my fellow commissioners for your faith in me and my leadership and partnership with the new chair to do this incredible work. I was honored to be nominated by Attorney General Becerra in 2017 to join this commission, and then reappointed by Attorney General Bonta just a few months ago. And I think part of my feeling of appreciation for being on this commission has really been our commitment to learning as we've been in this space together. I have been incredibly blessed and fortunate to learn from each of my fellow commissioners and from members of the public in the work that we're doing to improve mental health equity for every Californian. I think, building on our new chair's comments, this is really an incredible time for our state and our country to do something about the mental health and well-being of our communities, and in particular, focus on our most marginalized that have been doubly impacted by this pandemic, by the multiple pandemics that they're facing, COVID, the economy, racial injustice. And I just feel so honored to be in this space and to wear this hat alongside you in order to make something happen. There's a lot of work in front of us, and I will do all I can to show up better, to continue to learn, and to ensure that we're doing all we can to support the mental health and well-being of our families. This issue is personal for all of us, for so many of us. And because of that, we will do all we can to put our mind and our heart into the work and make you proud. So thank you very much. I'm honored.
Thank you so much, Commissioner Alvarez. And with that, we go to public comment.
Okay, it looks like we have one hand raised. Craig, your line is open. You can go ahead.
I'm there. Am I unmuted?
Yes.
Yes,
Hello?
we can hear you.
Okay. Thank you for your comments as your background and taking the position. I echo your thoughts. I have a son. It's been challenging since he was born. And my son with autism. That I've been leading, as I expressed in the beginning, these same sentiments. But I have a big concern that what I see in my field work of the last 5 years of government, we haven't understood about the logarithms and the preteen addictions, and it's not registering our licensee. As we go through this process of trying to do a good job, I'd ask the subcommittee to take this on as an agenda item, and some of the evidence I provided you, and also I provided you a letter yesterday. It took me 12 hours to write about programs that will bring a wellness, ecotherapy, and it's all there for the board to review. But I'd like to have a liaison within your office to work with, so we can get a awareness going of preteen addictions and the access to technology. It shouldn't be. And this is for us to really get on target what Utah has done: digital wellness, citizen, and safe technology. If we would do that and get I was at a school board county, and they had clueless about safe technology. If we're going to really get about this crisis we're in, I would encourage the leadership of this chair and others to put this as a focus, what Utah is doing, and bring some to your state government to be able to achieve those goals that you are passionate as I am. Thank you.
Thank you, Craig.
And that was the last public comment.
Okay, for public comment was closed.
Oh, no, I am so sorry. I just saw a hand come up. Jeremiah, your line is open. You may go ahead.
Thank you very much. My name is Jeremiah Aha. I serve as Assistant Director for Wellness Together School Mental Health. We're a nonprofit that partners with schools and just doing a lot of the same work that you all are doing and have been doing for some time, and supporting students and families. And just want to give my 100% support and just encouragement to Commissioner Alvarez and Vice Chair, now Chair, Madrigal Weiss, for the work that they are doing. I'm familiar with both of them in a little bit. I'm sure most of you have known them for a little bit longer, but I will say just the work that is being done in LA County and beyond with Children's Partnership has just been stellar, and just the leadership that they have there under your leadership, Commissioner Alvarez, and in San Diego County Office of Ed, Commissioner Madrigal Weiss, for what you've been doing there. And just to share, she and her leadership and her team have been instrumental in the success of the Blue Sky Initiative, a 5-year initiative with Blue Shield of California in serving students throughout San Diego County and as well as other parts of the state. And so depending on her and her team making data-driven decisions and really looking not so much at California Healthy Kids Survey and other data instruments that really demonstrate the need, but really has looked at that and understands the stories behind those numbers. It isn't just stats, it isn't just slides, but rather she knows what's happening at the site level at the over 40 school districts that are there in her county. So just really excited for the next couple of years to come, and just wanted to voice that even after the fact, but I was prepared to do that to endorse beforehand too. So just thank you both. Appreciate the time.
Thank you, Jeremiah. And with that, we are going to take a 10-minute break. I think we are, let me see where we are. Actually, we're ahead of schedule. We could do a 15-minute break. Is that right? We could go to 10:30. I need somebody to shake affirmative because we're ahead of schedule. Is that correct? Yes. How would we like a 15-minute break to really stretch, and because it won't put us behind schedule, so we'll still be good. All right, let's do a 15-minute break. We'll come back at 10:30. Thank you, everyone. See you at 10:30. We are going to continue moving forward. Item number 3 on our agenda is Shasta County Innovation Plan. The commission will consider approval of $1,750,000 in innovation funding for Shasta County's Hope Park Innovation Project. Commissioners, you've received the staff analysis in PowerPoint, and we are excited to discuss the innovation plan. Members of the public may request to make a public comment on item number 3 by clicking the raise hand button or on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue. So please make the request to comment now or as early as possible during this presentation. We will have a presentation from Donnell Ewert, Director of Shasta County Health and Human Services Agency. Thank you for being here today. Donnell, we would like to hear a high-level overview of the needs in your county which prompted this innovation plan, how the plan will address the needs, and how you plan to measure the outcomes. So with that, I want to turn it over to you, sir, so we can hear from you regarding Shasta County.
All right, thank you very much. Good morning to the commission and all the other attendees. Just one question. Is the PowerPoint going to go up on the screen? Oh, there we go. All right. So our innovation proposal is called the Hope Park Project, and it's an intergenerational approach to improving mental health, focused specifically on teens and older adults. Next slide. So what is the problem we're trying to solve in Shasta County? Well, we have the 2 objectives. One is to improve mental health well-being for older adults. And then the other is to improve the mental well-being of our teenagers. And we know with older adults, when sometimes the joys of retirement fades and the realization sets in that they don't have as many activities as they had, maybe they're not respected like they were when they had a full-time job, and then maybe some of their friends and family members begin to pass away, they do become more isolated. And we know that some older adults can go days without actually interacting with another person. And there's been a study done at the University of San Francisco that showed that participants 60 years and older who reported feeling lonely saw a 45% increase in their risk of death, and that isolated survey respondents also had a 59% greater risk of mental and physical decline than their more social counterparts. So we know that more social interaction is the antidote to this issue, and so we want to try to increase social interaction for older adults. As far as our teenagers, Shasta County unfortunately suffers a high rate of adverse childhood experiences. We did a study some years ago and found that 29% of the adults in our county had 5 or more adverse childhood experiences, which is a very high rate. This is compared to about 9% in the United States. So this is a significant problem in our community, and by the time our children become teenagers, many of them have had these adverse childhood experiences, and of course we want to reduce the frequency and their occurrence. So how can we want to try to mitigate the ACEs that have happened. So our goal then is to try to improve both the mental health of these populations by bringing them together. Next slide, please. So what is not working? We have been working to try to reach out to our older adults, but of course with COVID in particular, you know, this has become extremely difficult. They've been even more isolated than they were previously. Many times folks go into facilities for older adults to try to reach them, but these aren't oftentimes longer term relationships. They tend to be visits by well-meaning groups. And some folks, you know, just don't have family in the area. Also, we know that some teenagers have a limited number of caring adults in their lives and don't have a lot of venues where they can access that kind of resource outside of their families. We do have a robust response to adverse childhood experiences here called Strengthening Families Collaborative, and we are trying to integrate ACE prevention and mitigation into many of our institutions and programs. However, we don't have an intergenerational approach in any of those efforts so far. Next slide, please. Oh, I forgot to mention one thing on the previous slide, which is we have a very high suicide rate in Shasta County, and it's more than twice as high as the state. And the group with the highest suicide rate of completed suicide is our very oldest adults. And we've been working on suicide prevention since the beginning of MHSA, and it's very challenging. Very challenging to move that needle. So we're always looking for new ways to do that. So we are flipping the script a little bit with Hope Park. Instead of having folks go to seniors, we're going to bring seniors to the teenagers. And you know, we have a teen center already in the city of Anderson. It's been operating for about 20 years, and it's operated by Pathways to Hope for Children, the organization that will be implementing this program. And it is shown to be sustainable. They need volunteers there. And so basically reaching out to our seniors and having them volunteer is part of the objective of this project. In addition, Pathways to Hope will be establishing a brand new teen center in the city of Reading, which is our largest population center. It has half the people that live in our county. And so they'll be establishing a new teen center using a similar model. So not only will we be being able to use an existing teen center, but we'll be creating a new one. In addition, there's going to be outside activities through camps, and the older adults will be invited to participate in those places. And of course, we're not going to force them to do activities they're not comfortable with or physically able to do, but they can participate in a lot of ways as they see fit and as they're healthy to participate. So there's also whole family care that we hope to provide to families of the teens that participate. Pathways to Hope has capacity for that. And that will hopefully help mitigate the impacts of ACEs and provide more developmental assets in the lives of the teenagers. Next slide, please. So we're very excited about how our stakeholders participated in the creation of this innovation project. We actually asked our stakeholders for input into new ideas, and there's a great deal of interest in the needs of these two populations and the idea of bringing them together in one project. And so we did an RFP, and Pathways to Hope for Children proposed the Hope Park. And so this project is a direct result of stakeholder action. And here's a quote from one of our stakeholders, Danny Hayward from the Reading Rancheria Tribal Council. Childhood trauma is mentally, physically, and socially detrimental. If 200 local youth can be given a support system that includes mentors, healthy activities, and skill building, think how this can positively impact the lives of the future. The youth will grow up with the same positive light in their lives, taking what they've learned and raising healthy families on their own. And Mary Rickert, one of the members of our Board of Supervisors, said, I'm really excited about this. This is an excellent opportunity. Grandparents have a special relationship to teenagers. Both generations will benefit from this. So we have gotten support from our stakeholders, from our Mental Health, Alcohol, and Drug Advisory Board and our Board of Supervisors for the project. Next slide, please. So we do, our main research question is, does an intergenerational connection based on shared experience and meaningful interactions increase hope scores and well-being and reduce suicidal ideation among older adults and teens? And we will be using the validated Children's Hope Scale and the Adult Hope Scale for older adults, and other assessments to measure hope, flourishing, perceived stress, emotional well-being, suicidal ideation, ability to accomplish self-defined goals, ACE scores, and school engagement, interaction with law enforcement, and truancy to try to measure the impact of the project. Next slide. So here's the budget, which is difficult to read, but the bottom line is the annual budget for each year is $350,000. That is split pretty evenly between staff and other operating costs. And it does run for 5 years for a total of $1.75 million. I just want to mention that Pathways to Hope for Children is a longstanding organization in our community. It was previously called the Child Abuse Prevention Coordinating Council, and it has increased its budget. The current director, Michael Burke, has increased its budget in the last 2 years from $1.5 million to $2.3 million. He does have a gift for fundraising. We feel very confident about the sustainability of the project. And as I mentioned before, the Anderson Teen Center, which they operate, has existed for 20 years, and they have managed to fund it with a variety of projects over those years. And that's the last slide. And with that, we can take any questions.
Thank you so much. Thank you for being here this morning with us. At this time, I would like to open it up to my fellow commissioners for any questions or comments regarding the project. I don't see any hands raised. I do. Thank you. Commissioner Alvarez, please.
Thank you, Chair Mantrapal-Weiss. Thank you for the presentation. I'm excited to hear about what you are doing, especially looking at both ends of our age spectrum, right? Our young ones as well as our older adults, and even thinking about the relationship between older adults and young people and what that does to our mental health. I know there's been important research that reflects that. So thank you. I am interested, one of the quotes that you mentioned was from one of your tribal council members. Can you talk a little bit more about how you are responding to the unique needs of your diverse communities in the activities that you're promoting and in the work that you'll be doing with young people and older adults, and how culture and identity play a role in these sorts of interventions?
I'm going to call a friend and have Michael Burke respond to that, because I'm sure he'll be able to answer better than me. He's right here.
Yeah, thank you so much for the question. We get that a lot, actually, as we work with the Redding Rancheria Tribal Council and the tribal population quite a bit with our work. We will engage in, when we started doing work with teenagers, we've always had that lens of how can we be all encompassing? So we have an LGBTQ club inside of our teen center right now. We look forward to bringing our older adult volunteers into that work. We work directly with the tribe, creating activities, cultural activities. They've come up to our events and tribal dance and explain that, why that's important in their customs and traditions there. We also have tribal members on our board of directors at Pathways to Hope for Children. So we look for ways to bring culture into the teen center. We are a very, what are we, about 80%, 85% white community. So bringing in different cultures is really important to us at the teen center and different ways of looking at life. So we have that opportunity, and we look forward to expanding that to the older adults, where they get to express their views and their opinions and their life experience and share that with the teens.
I think she was on mute, but I believe Commissioner Alvarez said thank you. So thank you for that response. You appreciate it. Any other commissioners' questions or comments? Okay, I don't see any as I scan. At this time, I would ask if there are any public comments.
Can I make a comment?
Yes, of course, please.
Thank you. Just a quick comment, this sounds like a really interesting program, and to the extent that we would like to envision this program being successful and scaling it over time, one of the best ways is to provide some scientific efficacy of its effectiveness. And as it happens, we've got the ability to do that all contained with at UCSF. So it sounds like you're engaging in with the ACEs trauma folks at UCSF, and UCSF also has the leading center in the world in aging diseases, and has the ability to actually deeply study the brain impacts of this kind of a program. So what we might want to think about is a meeting where we could bring that together. We might be able to get like NIH funding to support that kind of study, and then and hopefully it shows the efficacy that we could then scale the program on a larger scale across the state. So please reach out to me and we can coordinate something like that.
Staff will help with that as well.
Yes, we will connect. Thank you, Commissioner. Thank you, Sharmel. Sharmel has taken note of that. Perfect. Any other questions or comments from our fellow commissioners? Seeing none, we will go to public comment. So if we can get that started, please.
Okay. Our first public comment is Craig. Your line is open. You may go ahead.
Yes, I applaud the concept. That's what I'm trying to achieve in Orange County. Our mayor and the board of OCTA wants to make a wellness center, and I've been struggling with this for a long time to get it there, but I'd like to encourage this commission to look at the Denmark study. The least amount of green space rises 55% mental illness, and water features are showing medically around the world to help calm, and I hope that you'll consider those studies, and also about the letter I submitted to you for consideration of the board. And also I would encourage this community to look at the Hope Squad in 34 states. There's 4 in Northern California and 8. I was the first one to bring it. It's peer to peer from elementary to high school. It's successful, and I'd like to see the movie Screenager part of that awareness for the youth and parents, because Dr. Danny Rustin is a good one. Dr. David Amen, physician, psychologist. Lisa Storm. While this is something that will be of value to your commission, it is something we should be identifying to guide our dollars to investment, to a true stability of too much screen time. And there's a lot of research I sent you in this document, 18 points, that this will give you the sense of where we are. And I appreciate the commission's consideration for our district in the same kind of a program, a rail trail program. And it'd be beautiful if we could do that and multiply it. So thank you for the hard work in Shasta County, and I appreciate the commission's interest, and I thank you for the time. Thank you.
Thank you, Greg.
Okay, next, Tiffany, your line is open. You may go ahead.
Good morning. Can you hear me okay?
Yes.
Awesome. Thank you. Tiffany Carter, Statewide Advocacy Liaison with Cal Voices. And I would like to just take a moment to, well, my 20-month-old has something to say as well, pardon me. But take a moment to acknowledge that I can definitely appreciate the intersection that Shasta County is trying to accommodate right now between elderly and youth. I think that the collaboration and the unique opportunities for these two populations to come together is amazing, and definitely necessary across the state for sure. I do have 2 concerns, however, that I would be very disappointed to not bring up and see what Shasta County has in mind. One is I don't see any mention and elevation of the peer role in this particular project. Really wondering how peers, those with lived experience, are going to be utilized and elevated in all aspects of the project. Additionally, I'd really like to, and I hate to bring it up because it's an uncomfortable topic, but it's very real. How is this project planning on protecting the vulnerable youth?
Transferred to a clerk.
The vulnerable youth from adult predators, and making sure that there's protection on both ends, if I can even say that. So what are the ways that this is being handled, foreseen to really ensure that safety and inclusion is completely utilized in all aspects, and again, the elevation of peers? Thank you.
Thank you for that comment. We do understand the importance of lived experience, and Michael is been running some camps for children who've experienced a lot of ACEs, and he's very cognizant of that and does recruit volunteers with lived experience, and including seniors. So we have a lot of seniors, like I mentioned, how high the ACEs are in our community. We have adults that have experienced some traumatic events in their youth who hopefully will be able to bring that experience to this opportunity. So he may want to talk a little bit more about that. And then as far as this vetting of the volunteers, I think he's got a whole process for that as well. That's quite thorough. So I'm going to let Michael comment on those two things.
Sure. First off, thanks, Donnell, for the vetting of the people. We do a DOJ background check. We do the Megan's Law sexual assault predator background check. We operate under a rule of 3, so no person is ever alone with a child at any time. So we take that very seriously. As Donnell said, I've ran a program called Camp Hope for over 10 years now, where we've brought in very vulnerable kids exposed to domestic violence, sexual assault, and child abuse to a camp where we actually use peers. In the cabin are 17 to 26-year-olds, and then adults to support them there. But so we're very, very focused on protecting the vulnerable populations in our community. And in terms of peers, you speak to my heart, because in my last job, I ran a national domestic violence survivor group called Voices, where we brought peers into communities all over America to help survivors of domestic violence learn that there was another way out. Currently at Pathways to Hope for Children, we have 23 parent partners on staff, which are peers that work with families. So having that experience and model about bringing peers into the workspace, as Donnell said, we have 40% of our population has an ACE score of 4 or higher, and we know that in working with Hope Theory, in 2,000 published studies on hope, it's the single best predictor of well-being over any other measure of trauma recovery. We bring in high hope people that can help these kids learn that there is a way out. So I hope that answers your question, Tiffany. We are very dedicated to ensure the safety of the kids. I think the rule of 3, the background checks, the 20-hour academy. If you read the application, it's got a 20-hour volunteer academy, where I'm sure some people might not make it through that. And then we also have that peer support that's vital and part of our core values here at Pathways.
Thank you so much. And yes, it was included in your original plan and the analysis, and appreciate the mention of the background checks, and as well as the mandated reporting, and your inclusion too of the peers that is there as well. So you can reference it on page 3 of the analysis. So again, thank you for your time and for your presentation. And so at this time, I would ask if there are no other questions that have come up since, or comments from our fellow commissioners, then I would ask Cody, please, if you could put up on screen the motion. So the proposed motion. So do I have a motion from any of my fellow commissioners? The commission approves Shasta County Innovation Plan as follows.
So moved. Commissioner
you.
Mitchell.
Thank you, Commissioner Mitchell. And do I have a second?
Second.
Thank you, Commissioner Alvarez. Any additional questions or comments? Seeing none, hearing none, I would ask Chief Counsel to please call roll.
Certainly. Commissioner Alvarez,
Aye.
Commissioner Bontrager,
Abstain.
Commissioner Boyd, Commissioner Brown, Commissioner Bunch.
Aye.
Thank you. Commissioner Carnavale.
Yes.
Thank you. Commissioner Correa. Commissioner Chen. Commissioner Chen. Commissioner Cortese.
Aye.
Thank you. Commissioner Danovich.
Aye.
Thank you. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Abstain.
Commissioner Tamplin.
Aye.
Thank you. Commissioner Wooten. Acting Chair Madrigal-Weiss.
Approved.
All right, the motion passes.
Excellent. Congratulations, Shasta County. We look forward to hearing of your great success there. Take care. Thank you so much, and thank you for presenting and being here with us today.
Thank you very much to the commission.
Thank you. At this time, we are going to move forward with item number 4, Alameda County Innovation Plan. On item number 4, the commission will consider augmenting the Community Assessment Transportation Team, CAT, Innovation Project for an additional $4,759,312 in innovation spending authority. The augmentation would bring the total authorized innovation expenditure for this project to $14,637,394 over 5 years. The original innovation project was approved by the commission on October 25th, 2018 for over $9 million over 5 years. Commissioners have received the staff analysis and PowerPoint, and we're excited to discuss the innovation plan. Again, members of the public may request to make public comment on item 4 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue, so please make the request to comment now or as early as possible during the presentation. We will now have a presentation from Yolanda Takahashi, Emergency Medical Services Coordinator, CAT Project Manager. Thank you for being here today, Yolanda. We would like to hear that high-level overview of the needs in your county, which prompted this extension, how the plan will address the needs, and how you plan to measure the outcomes. So Yolanda, your mic should be off mute. And I'm sorry, before this, I do have a hand raised, which I saw from Commissioner Tamplin.
Thank you, Chair Madrigal-Weiss. I just wanted to share, I will be recusing myself from this agenda item. Thank you.
Thank you, Commissioner Tamplin. And with that, I would invite Yolanda to come forward. You should be off of mute and your slides are on screen now.
Great, thank you. So our CAT program, so our current project started in October 2018. So the persons experiencing mental health crisis was identified as one of our most undeserved populations in Alameda County. We have the highest rate of 5150s, which includes 5585s for adolescent holds in California. So 75% of those clients on those holds were transported to psychiatric services and also to emergency departments and did not need medical necessity for inpatient acute psychiatric services. So what would happen is they would just be discharged, and those that were placed on holds were normally not linked to appropriate services. So the response in 2018, this commission approved on October 2018 18 for us to partner an EMT and a behavioral health clinician to respond to calls via the 911 system. What our team does, they relieve the officer and assess the person in crisis who may not actually require a 5150, but after the evaluation, they would transport to support services for those clients. Next slide. So some of the challenges since our program is clinician hiring, the retention basically of clinicians and EMTs. We've actually hired since the beginning of the program that started in 2020, 13 clinicians and 21 EMTs. Currently today, we have a total of 7 clinicians. One of those clinicians are part-time and 6 full-times. And then we have 7 full-time EMTs and 9 part-time EMTs, a total of 16 EMTs. Also, our training curriculum had to change due to the pandemic. We also had issues with General Motors going on strike and causing a delay in the delivery and outfitting of our vehicles. There was also lack of broad range of facilities receiving clients during the pandemic. Some of them closed completely and others actually only had about 50% capacity. So many facilities also don't accept private insurance, which is also a big challenge on trying to get services to our clients. And then based off of this program, we have the Board of Supervisors wanting our CAT to quickly expand throughout the county. So it's, that's not only a challenge, it's actually kind of an accomplishment because they're recognizing that our teams are working out there for the system. So our CAT, so additional accomplishments since our CAT program started in 2020, it was done in the middle of the pandemic. We were able to start rollout with 3 units at that time. Currently, we have 6 teams out in the field throughout the week. During our first 6 months, 1/3 of CAT transports went to CBOs for service instead of being placed on a hold. So those didn't go to psych services or to emergency departments. We were able to get them services. And then again, due to that success and the trust gained from the Board of Supervisors and other cities hearing about the work that CAT's been doing, it's desired that these teams go 24/7 in the county, and it also does law enforcement also appreciates our program and would like to see it expand as well as the CBOs. Next slide. So the community contribution, community program planning process in 2017 identified persons experiencing a mental health crisis were identified as one of the most undeserved populations, and that was about 54%. Our updates are being given to the MHSA stakeholder committees quarterly. And then for the peers organization community change, the Alameda's peer organization, they assist with focus groups and community engagement. And then we have our CAT evaluator, which is the public consulting group, and they do follow up with clients who have used CAT services and also do focus groups with stakeholders and consumers. And they did a 6-month report, and they will be presenting a year report as well tomorrow. Next slide. So what we've learned so far is the training that has been developed for our program has been excellent. We had to change it up. We had to move the majority to the training online. It has worked. Though EMS sees CAT teams as a specialty unit, which requires continuing education and higher pay. So that's some of the things that we're learning, that because it's a specialty unit, we need more education for our teams, and they're requiring higher pay for that due to the extra overtime it takes to do the training. Behavioral health plans regularly also require higher pay because working in the field answering crisis calls is not for everyone. So there's been some bonuses involved with that on the clinician side, and then on the EMT side, There's been stipends involved due to the fact that not all of our EMTs out for the 911 provider are desired working on a mental health crisis team. Although our CAT teams do outreach unless requested when a person is experiencing a crisis, this reducing recidivism is a goal, and we can track that, and we do that through our programs that we have, which is our ESO that is used for documentation. We're able to retrack any recidivism that we have out there. And then the Alameda Triage Grant does do outreach and engagement by providing linkage services to our clients with 3 or more mobile crisis contacts and or 4 or more visits to psychiatric services. And this is a typo. They do that within a 6-month period, not a 1-month period. Next slide. So this is the spending to date and additional funds being requested. So far we've spent $3,824.94. And then the additional funding, as noted, being requested is the $4,759,312. And a lot of the additional funding is due to the EMTs ended up going through a contract negotiation, and we were surprised that they actually got a 5% increased COLA for their contract, and that wasn't expected. So, and then also they have an hourly wage, and a lot of times they are held after their 12-hour shifts, and that accrues overtime as well. So we weren't seeing that in the initial budget as well. And then also we've been requested to add additional items, for instance, a program that will help with live time dispatching, which will let them know exact time frame to get to a scene of a call. And also for safety issues, purchasing additional fobs to open the doors of the vehicle, so both team members have the ability to rapidly access the vehicle. There are other things involved with some of the additional fundings that includes just the cost of living. Gas prices have went up. The food prices have all gone up since the pandemic. We provide supplies for our clients, snacks and water, blankets for them. And then also we supply our teams with additional uniforms for wear and tear and whatnot. So some of those weren't added into the initial budget. And so we're trying to see what we can do to help with get additional funding requests for this. Next slide. So the proposed motion, the commission. Okay, I think that's the end of my slides. Sorry.
Thank you for that. Thank you, Lila, for being here. At this time, I would ask my commissioners if there are questions or comments regarding this plan. Commissioner Alvarez.
Sure. Thank you so much, Chair Madrigal-Weiss, and with huge thanks to the staff for the analysis that they prepared. Just one question for you. Part of our challenge as commissioners is to ensure that we are supporting initiatives uniquely through the many funding streams that the Mental Health Services Act supports. And one of the things that we've been exploring with this program in particular is that Alameda County has received triage grant funding and is utilizing a portion of those funds for mobile crisis teams as part of the triage program. Could you talk to us a little bit about how the positions funded with triage grants differ from the positions requested through this innovation extension request?
I'd like to invite Stephanie Lewis from ACBH. I think she may be able to answer a little bit more.
Hi, everyone. I'm Stephanie Lewis, the Division Director for Crisis Services at Alameda County Behavioral Health Care. And so our triage granted provide outreach and engagement post-crisis for more of our chronically homeless individuals, our familiar faces, which is our high utilizer team, and for post-crisis follow-up. So if you think about the crisis continuum of care as a circle, that triage grant closes the circle and provides interventions and linkage to care after they have contact with the mobile crisis team. CAT is one of the mobile crisis teams, but we have 2 other types of models we are running in Alameda County, one of which is a 2-clinician model and another is a clinician and law enforcement model. So those are different programs, and we are really looking at CAT to really speak to our other models to give us information about the best course of action to take. What is the best type of model for Alameda County? So hopefully that answers the question, the difference between the triage funded ones and CAT.
If I'm understanding correctly, Stephanie, I just want to repeat back what you said, just so that I'm clear. The mobile crisis teams that operate are funded both by triage funds as well as this innovation fund. However, with the triage funds in particular, they're serving a different purpose. It's outreach and engagement post-crisis, as opposed to either during or in preventing it. Is that right?
So it is. So they are actually doing outreach and engagement post-crisis.
Okay.
Yeah, because what we found was that we have services to meet the needs of people in the immediate crisis, but it's after they go to the hospital, after the linkage to a crisis stabilization unit happens. We want to prevent subsequent crisis by connecting them to services and doing warm handoffs. So those triage funds help with that portion of that crisis work, post-crisis.
Thank you, Stephanie.
Thank you. Commissioner Gordon, please.
Thank you. I get the difficulties involved in starting this up during the pandemic. Any of us working at the local level can empathize with that. And also the need to expand the scale of this to really test its viability. I guess on the back end, though, the question I'd ask is, this is getting to be a pretty big number to convert to as a county if after the innovation pilot, you're going to make this county practice. What is being done with the county to project the cost of the sustainability of this? And is the county getting prepared to switch to this model using its own funds?
So I would say that we are still so early in this project. We're still learning from it to determine if this is the best model to switch to. What we are looking at is possibly a combination of all the models that we have as the best course of action. And so, yes, we are looking at sustainability in terms of reimbursements through Medi-Cal billing, but also open and vacant positions that we have within our crisis division. And also, we have been meeting with various cities to determine what their specific needs are. So we may be looking at a hybrid kind of situation anyway throughout the county, depending on what those cities need. So we're definitely looking at the sustainability and how much of the CAT program we can absorb post-pilot.
Thank you, Stephanie. At this time, I do not see any other comments or questions from our fellow commissioners. So I would ask to move to public comment.
Okay, it looks like we have one public comment. Craig, your line is open and you may go ahead.
In Orange County, they have a BWEL program, and there's now 4 cities. But I found in Utah in Nevada, under 18 program. BWell has not identified the prevention for the technology and help the schools deviate from that so that they become well. And I encourage this commission, as they spend this kind of money, that you target the under 18. And we don't go take a child to a heart doctor, we take it to a pediatrician. And so this program, I believe, is start with Nevada for under 18 programs. So that's what you're trying to do, but get this prevention going so we don't have the aftermath you're trying to deal with now. And I encourage you to read my letter I gave Brian Sayas and the commission. It shows out what I project to do, and our state laws would be changed, so we don't have all this money poured out in different ways forever. That's my biggest concern. We want to use money wisely but effectively, and we need to target our youth in how to understand them, these technicians versus our officer, because all we're doing is delaying the worst of your efforts to stop these issues. And that's my research, and I hope your commission will work with me and your team, because I can show you clearly on the research I have for 23 years that we are not hitting the note because of ideology of medical practices and thoughts versus what's out there in fact. And I would encourage you, I have respect for many of law enforcement agencies and communities, and I think we should be coming in tune to under 18 and get it to our school boards or compliant prevention than be distant from prevention of child abuse fairly in state. That's where we are in this situation. I'd be frank, but we're putting our kids at risk over this. Thank you.
Thank you, Craig. I see no other public comment. At this time, I would ask that we post back, Cody, thank you so much. On the screen, the motion, you know what I'm talking about. Excellent, thank you. I would ask, do I have a motion?
Commissioner Mitchell, so moved.
Thank you, Commissioner Mitchell. Do I have a second?
I'll second it.
Thank you, Commissioner. Chief Counsel, I would ask you to please take roll.
Yes. Commissioner Alvarez. Thank you. Commissioner Bontrager.
Dang.
Abstain. Thank you. Commissioner Boyd. Commissioner Brown. Commissioner Bunch. Thank you. Commissioner Carnavale.
Yes.
Thank you. Commissioner Carrillo. Commissioner Carrillo. Commissioner Chan.
Aye.
Thank you. Commissioner Cortese.
Aye.
Thank you. Commissioner Danovich. Commissioner Gordon.
Aye.
Thank you. Commissioner Mitchell.
Approved.
Thank you. Commissioner Rolette.
Abstain.
Commissioner Tamplin. Commissioner Wooten. Acting Chair Madrigal Weiss.
Approve.
Thank you. The motion passes.
Congratulations. Yolanda, thank you so much for presenting, and Stephanie, it has passed. So we look forward to hearing updates, and congratulations on your plan. Thank you for being here today.
Thank you. Take care, everyone.
Thank you. Have an excellent day.
Too.
All right, we have arrived to item number 5 on our agenda. It is 11:17. I want to say we are still ahead of schedule. So at this time, we are going to go ahead and hear from the commission. Will hear recommendations from the Anti-Bullying Advisory Committee and a proposal to allocate $5 million to create a digital peer support network for children and youth who have been bullied based on their race, ethnicity, language, or country of origin. As you may recall, commission staff outlined in their budget presentation in August that the governor and legislature included $5 million in the commission budget to address bullying, with the stipulation that these funds be used to support anti-bullying efforts very quickly. The budget called for these funds to be in contracts by the end of October. We have missed that deadline and there is additional work to be done. The commission's rules of procedure generally require contracts above $100,000 to be approved by the commission. Given that our next meeting will not be scheduled until late January, the proposal on the agenda is to delegate that spending authority to the chair of the advisory committee, Commissioner Chen, and myself as acting chair. That is the item for your consideration. Members of the public may request to make public comment on item number 5 by clicking the raise hand button on your computer or the app, or by pressing *9 on your phone. Once the public comment period starts, we will close the public comment queue, so please make requests to comment now or as early as possible during the presentation. We will now have a presentation from Anna Nafee. God, Anna, I hope I got that right.
That's right.
I did it. Yes. All right. Thank you. From Anna Nafee, consulting psychologist, Miriam Bookey, partner and founder of Program 11. Thank you both for being here today and speaking to us. We're excited to hear about your project and future opportunities that we have. And with that, I pass it on to you, ladies.
You. So yeah, I'll introduce myself again. I'm Anna Nafee. I'm the consulting psychologist and the project lead for this anti-bullying social media project. My pronouns are she, her, and hers. We have a slight change in our other speaker. We'll have Marie Martin from Program 11, who did the research that supported some of this project. And I'll introduce her in a minute. So to start, we know that bullying, discrimination, and even violence happens toward our youth because of race, ethnicity, language, culture, and we know how devastating that can be. Over the course of this project, which has been very, very quick and intensive, we've heard from young people, sometimes tearfully, about how bullying has affected their well-being. And this has been exacerbated during COVID and during a lot of the social reckoning that's happened on race the last couple of years. We know that bullying can deeply impact self-esteem, mental health, and even can lead to violence and self-harm. We also know that you spend a lot of time on social media, and so that's part of where the foundation of this project. Next slide, please. So as part of the API equity budget this year that was passed in July, the API Legislative Caucus passed a 3-year investment of $166.5 million in the API community. $5 million of that was allocated for us to create a peer support social media network for children and youth. And this is to have an emphasis on students who have experienced bullying based on race, ethnicity, language, country of origin, perceived race, ethnicity, or country of origin. We had a very tight timeline between, it was sort of toward the end of July, and the first deadline was August 31st. We were to have our first advisory committee meeting. And so very quickly, we pulled together an advisory committee of about 20 youth and adult allies, majority youth, and got to work. We've worked with Assemblymember Ting's office, the Asian Pacific Islander Caucus, the Commission on API AA Affairs, and other community nonprofits throughout. And we are supposed to enter into contract October 31st. We wanted to have 3 advisory committee meetings before we started the contracting process to make sure that we heard sufficiently from the advisory committee. The other thing I'll say is that while this came from the API equity budget, we heard a lot from the committee about how important this is to address all youth. And we heard a lot about intersectionality among youth. And then finally, I wanted to say that this strategy is really meant to prevent mental health needs from emerging from the impact of bullying, to amplify and empower youth voice and in the creation of the programs that serve them, to promote community among youth and resiliency, and to increase access to care. Next slide, please. And so as you can see, between the end of July and now, we've gone through a process where one of the first things that we did after we formed the advisory committee was to bring on 2 contractors, Program 11, which helped us do some background research and who we'll hear from today, and also Youth Leadership Institute, YLI, who helped us with committee engagement and centering youth voice throughout the process. The advisory committee included youth from all over the state, as well as adult allies that included mental health and bullying prevention providers, nationally recognized anti-hate and bullying researchers, API community leaders, representatives from the Department of the CDPH, the Department of Violence Prevention, representative from Lady Gaga's Born This Way Foundation, and other youth innovation experts. Next slide, please. I wanted to thank our partners in the start of this project, Program 11 and YLI, Miriam and Jenna from Program 11 and their team, and Patty from YLI and her team. And then I'd like to introduce Marie Martin, who's going to walk us through some of the research that really laid the foundation for how we came to design the recommendations for this project. We wanted to start with identifying from the committee, what are those areas of focus? What are the kinds of attributes that we want to look for in contractors? And what are the outcomes that we want to see when we go to contract and create this program. And in order to do that, we started with some research very quickly within a couple of weeks to gather information and to bring back to the committee so that the committee would have something to respond to. And so Marie Martin, I'd like to introduce Marie Martin from Program 11. She's a subject matter expert in the areas of education, and a former teacher and administrator, specialty in equity and education, social emotional learning, educational technology, and second language acquisition. And she's a doctoral candidate currently in educational research at the University of Southern California. So Marie, I'll hand it to you. You can go to the next slide, please.
Thank you so much, Anna. I really appreciate it. And I also want to thank the Commission for the opportunity to present our findings and also our proposal today. I feel that the work that we are doing here is very important to our youth, and I am excited to have been a part of this journey with you. So thank you. What we did first, our methodology is we did a lot of different interviews and surveys. We conducted 30-minute interviews with about 14 members of the committee, and also recommended participants. We also shared interview questions via survey with those who couldn't attend. And we also asked within the interviews if anyone had any information or any research that they wanted to add to this research or to our research. We asked for them to share any documents with us, and we also reviewed those documents as well. So thank you so much for those who participated and gave your time to work with us as we were going through this process. We then also simultaneously did a literature review where we reviewed young adult adolescent research on bullying for the past 3 years. So we kept it just in a short window of time with an eye towards how the work could impact our findings. Next, we analyzed and derived our top findings, which you will see pretty soon. And we also asked for the committee and public feedback, and we asked for questions and feedback on our work so we could refine. And then lastly, program recommendations. We took all of that information, all of the information that you gave us, and refined our findings. And we developed audience journeys and collected committee recommendations for partners who could bring this work to life. Please go to the next slide. And the next slide, thank you. So as you can see here, we did present this in September. These are the major themes or the emerging themes that we saw. The enable peer support, empowering youth to create solutions, create video content, testimonials, make resources readily available, let the youth drive this when it launches, research our audiences where they are, reach our audiences where they are, recognize bullying is different for different communities, recognizing that there's differing levels of trust, considering our underserved youth with barriers to technology access, and then tailoring the outreach in for various markets. Next slide, please. And as you can see, if you were to go through this PowerPoint, which we also presented in September, so I'll just do a quick overview. Our question 1 was all about the ideal digital support system for victims of bullying, who is invited, what type of interactive platforms, why they would come, and how they would get there. Next slide, please. Question 2, what platforms will you most likely use to find support? And that's the breakdown of what they would find or what social platforms they would use. Next slide. Who do you think youth will trust most to connect with? Of course, their peers, right? And we have other people there as well, but mostly we knew it was the peers because they, many peers, a lot of our young adults and adults in our specialists said peers first. So next slide, please. What does success look like once this initiative is rolled out? And platform interaction, how many shares, right? How are they linked to resource? Those were the top 3 that we saw, 3 or 4 ideas that we saw. Raised awareness, surveys, reach, okay? Next slide, please. So our research takeaway number 1 was that this program is designed as a peer support network. And so whatever we create must be seen as experienced as a peer-to-peer lived experience network. And we got this takeaway because many comments were surrounding how it needed to be driven by peers and also have the peer voice involved throughout the process. Okay. Next slide, please. Research takeaway number 2 is to make this a program by the youth for the youth. And it's really about that if you're going to create it for us, it must be led and driven by us. And so we heard this time and time again, that in order for this to work, the program and accompanying social media campaign must come from the hearts and minds of the youth and beautifully produced, but mostly making sure that it is by them. And then our third takeaway, if you can go to the next slide, please, is to ensure that it's always on and to meet them where they are. And we want to make sure that when we say always on and meeting them where they are, is that we are bringing in so many different voices of the youth that also do not have as much access to the technology. We want to make sure that we find ways to reach them as well. But yeah, bullying is a 24/7 experience, and this program needs to have an always on component, and it almost needs to act like a crisis hotline, and then have a place where it can bounce to where they can get additional resources or counseling services. Next slide. And so I'm going to pass it back to Anna and talk about how we met within the different committee meetings and how you shaped our ideas for our future plans. Thank you so much.
Thank you, Marie. So like I said, what we did when we started this was we did this research, brought it back to the committee in the second committee meeting in September, and asked for feedback from them. Next slide, please. And so a large, sorry. Yeah, that was not the slide I was anticipating, but that's fine. So in the first committee meeting, we just did a lot of community building amongst the committee. And then, like I said, we positioned the questions in the second committee around what we're trying to do, who we're trying to reach. And then by the third committee meeting, we really narrowed it down to some core components that we wanted to focus on. And these components are the attributes or the qualities that we're looking for in contractors when we ultimately go and launch this program. Next slide, please. Oh, and we also asked for a lot of recommendations for contractors and kept a running list of that. So in terms of process, this was primarily youth engagement, youth-driven process. We used a lot of Jamboards. And like I said, started with community building in the beginning of each meeting. Next slide, please. We had a lot of conversations about what messages would be important in the social media project. What do we want the youth to talk about in terms of bullying awareness or how to connect with resources. We talked about who are the target audiences. We had conversations about, is this only for youth? Or is this also for parents and teachers and bystanders, or even people who are doing the bullying themselves? And how might the messages be tailored to those things? And all of this was designed to inform the needs of youth and the components of the program. Next slide, please. And so I love this image, so I'll pause for like a second here. Next slide, please. And so ultimately, we took all of this information and organized it into three main buckets or three main categories. And so the first component is that we want to have a peer-to-peer resource available that we would link to support youth who have been bullied. And this could look like a hotline that is run by peers that youth could call and talk to other youth and get support as they need it. Secondly, and this is sort of the bulk of the project, is the social media strategy. So the project we will contract with a social media group that can help develop the social media strategy and build it out. There's a lot of technology and communications knowledge and awareness that needs to be included in this. And also included in this bucket is the paid advertising and paid amplification of this work, so that we get the media the messages out. We heard a lot about engaging influencers on social media and how we could use that to connect to youth and build confidence in the messages that are out there. And then the third bucket is the again, we heard over and over again that this needs to be youth designed, that the resources need to be those that youth will actually use, and that there are resources in the local communities that we're connecting youth to. And so we want to be able to continue to engage the committee. The committee will probably morph a little bit into more of a youth-driven committee to advise the social media group more around messaging and influencers and all of that. And to engage other cultural ambassadors to be able to create the messaging and connect with the resources in the community. The other thing youth said is that they wanted to see videos and music and art and a lot of like multimedia. And so there's a piece of this in there in engaging, being able to support youth in creating their own content in those multimedia platforms. Next slide, please. And so the proposed motion is that the commission authorize the executive director with the approval of the advisory committee chair, Commissioner Chen, and commission chair to enter into one or more contracts for up to $5 million and implement an anti-bullying social media network as directed by the state budget. And we want to make sure that the contractor or contractors have demonstrated expertise in multicultural youth engagement, social media and website management, and youth peer-to-peer support. And that's all. Thank you.
Thank you so much, Anna. Thank you for that presentation. And thank you, Marie. At this time, I would like to ask my fellow commissioners if there's any questions or comments regarding this project. Please, Commissioner Gordon.
I think this is extremely well done and very badly needed. And I think this can be a prototype for work that can be done both on other issues and in other areas of the state where we need to connect much more effectively with youth. This is one of our own priorities locally in my county. So I appreciate the work very much and look forward to supporting it and helping on it.
Thank you, Commissioner Gordon. Any other commissioners' comments or questions? Please, Commissioner Alvarez.
Thank you for the presentation. I agree with my fellow commissioner, Commissioner Gordon, in support for the overall project. And forgive me if you all, if the commission has had this conversation before. I was not at the September meeting. I was still on leave. So if any of this is repetitive, I apologize in advance for that. And I'm sorry, I have a little one too who is making some noises. I have a few questions and just some comments. So, you know, one is I really commend the process, the inclusive process that went into this. Like, we've got obviously a lot to learn from that, and the ability to be so intentional with having youth at the table. I just really commend, you know, the committee's work around that. But I'm curious how this aligns with the governor's Child and Behavioral Youth Health Initiative, the $4.4 billion, and in particular, the hundreds of millions of dollars that are going to a virtual social platform. And if there's a way to align the efforts, right? Because they're obviously so in sync in trying to utilize technology to improve access to services and education for young people. And if there isn't, I don't think that's horrible. I just think there's an opportunity there to ensure that we're aligning with the administration more intentionally. And then I think it speaks to, as we approved at the last commission meeting, the need for a children's committee that allows us to really explore how these various initiatives work together to strengthen our commitment to child and youth well-being, right? So that's one question I have. The second one that I want to be mindful of, because we, so wearing my children's partnership hat, we have the honor of leading our Hope Healing and Health Collective, which similarly looks at mental health and well-being, particularly amongst Black girls, Latinas, and Native American youth. And social media has come up as an incredible tool and resource for young people. But on the flip side, there is an important reality that social media is also very damaging. And that is obviously getting a deal of attention. For example, just today, Attorney General Bonta announced a nationwide investigation into Instagram's impact on the mental health of young people. So I want to be mindful that as we're promoting social media as a tool, what sort of protections are we putting in place? What sort of accountability are we looking for some of these social media companies to have to prioritize the well-being of our young people. And again, I'm not expecting us to have the answers right now, but that we be cautious in our approach as we see this as a tool, so that it is not abused, and that we are, protecting young people. So that's and again, that could be another conversation that we have, and as we move forward. But those are just some of the comments. And again, I really want to commend, the work that's been done. The horrific attacks on our Asian American and Pacific Islander community over the last couple of years have been heartbreaking. And this sort of specific attention to this population not only strengthens their well-being, but frankly will have important ramifications for our young people as a whole. So congratulations.
Commissioner, I'd like to respond to that, and thank you, Anna, for the phenomenal presentation and overview on that. In terms of your comment about aligning with the broader initiative, in providing these funds to the commission, the budget committee was very clear that this was about speed. They put into the language that we were expected to be in contract by October 31st. That's a 90-day turnaround. We've missed that. We've missed that for some very justifiable reasons. Part of the reason this is on the agenda is if the commission does not authorize basically the motion is to delegate the commission's full authority, the full commission, to the chair, and then Commissioner Chen as the chair of the committee on this project. And that's so that we can act quickly. We have reached out to the governor's team regarding the broader initiative to make sure that our work is aligned with their work, and to highlight the significance of youth engagement that we're doing in this project, that we've done on the youth innovation work. And so that's a conversation that is still underway, that the administration is really beginning to stand up that project. It was envisioned to have this year as a planning year. And so the timing doesn't allow us to make sure that there's that alignment on the front end at this point of this project, but we're hoping that as our work moves forward, that we can inform their work in some very formal strategic ways. And so I love your comment about the children's subcommittee, and I think with our new chair and our new vice chair, we need to revisit that and how that's going to work. In terms of the impact of social media, you're absolutely right. This is an area where there's a lot of inquiry going on nationally, internationally, here at home. That issue came up in the commission's work around suicide prevention as well. And so I think we're aware of that concern, and really trying to work closely with community organizations who have more expertise in actually care delivery and engagement. And part of the reason, frankly, for the delay in this work is this project is, although it is so urgent and seemingly straightforward, it is pulling together social media, youth-driven content, anti-bullying strategies, really wanting to be based in the vision, voice, and vote of young people, and done in a way that recognizes the trauma associated with bullying and related behaviors that are driven by race, ethnicity, language, and culture. And so there's like 6 or 7 pieces here, and it's been very difficult to find partners in the community who can do that on a statewide basis. And that is the direction. And to do so with only $5 million, we alerted the legislature and the administration that very ambitious, and their response to us is do the best we can quickly. So, the vote today, again, is to ask the full commission to delegate to the chair and the chair of the committee the approval authority, so that we don't have to wait until January, the end of January, to begin to do this work. So hope that answers your question, even if in a roundabout way, and I apologize about that.
No, it does. Thank you, Toby. I appreciate that. And I hope, as your commissioners, whatever we can do to be helpful with those conversations, we will. I do have one other question. I'm so sorry. And that is just related to monitoring and evaluation. So $3.5 million in social media sounds like a lot of money, but as you know, like media buys are just ridiculous, right? Especially if you want to do targeted media buys. So I appreciate, this is a drop in the bucket, but it is an important drop in the bucket that can lead to more. Are we able to figure out or track, with counties as our partners, if it's making a difference, right? So if we know we did an ad buy in Los Angeles, for example, did we see an uptake in API use utilizing services through our community partners? And I know that's ambitious, right? That direct correlation, but trying to figure out if this investment is actually leading to young people utilizing these services and supports. If we're promoting certain partners, if we're promoting certain programs, I think that's something to consider. And then in general, Toby, to your point about how this will inform what the state eventually does after this planning year, there's an opportunity to, I'm so sorry. To inform that process as a result of this, like the lessons that we have from this evaluation.
So, yeah, so if you notice in the, Anna wrote the language that it's up to 3.5 million, right? Because social media, it is very expensive. And so these are some sort of general guidelines as we work towards the specific details so that we can work with Chair Madrigal-Weiss and Commissioner Chen to kind of fine tune that. Frankly, we haven't even gotten to the point where we want to be able to say, show us how, the impact that this has had, in part because there's such an urgency, as Commissioner Gordon's pointed out, as you've pointed out, but that is the intent, particularly as we engage with the administration on the broader initiative and around that digital strategy, that there's just, so much to learn in terms of how these digital strategies, these social media strategies, how can we understand the impact that they're having? Our private sector partners are much better at being able to track that impact than we are, but I think there's, as you've pointed out, that is an opportunity and we have to learn a lot more about that.
Great, thank you. Thanks again.
Thank you, Commissioner Alvarez. Any other questions or comments from our commissioners? Seeing none. Anna, I wanted to thank you for lifting this work, and also Commissioner Chen. We keep working with our youth groups and talking to them, and something that recently happened in one of our groups was, asking them what is most important to you, and we were talking about just education in general, and they said, ask me what I want to learn, right? Just we keep promoting those things, sticking to our agendas and what, our standards, and it was just ask me what I want to learn and make it engage me, care enough to hear me and make my learning relevant to me and meaningful to me. And so I appreciate the engagement that you've put into this, especially with such an important topic. And peer-to-peer is extremely important. We know that our youth are going to listen to our youth, right? They have that experience, they speak in their language. So I appreciate that. And I appreciate funding towards those activities. We want to honor our cultural brokers, and those are the youth. So I think the thoughtfulness of it, even though I know we're pressed for time and trying to get this done. So thank you for sharing this presentation. At this time, I would like to move forward with public comment. So if we can go ahead and get that started, please.
Okay, our first commenter is Stacy. Your line is open. You may go ahead.
Hello, Commissioners. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition. I would like to raise concerns with this project as it has been rolling out so far. As noted, this project is funded by the API Equity Budget, sponsored by the Asian Pacific Islander Caucus. On their website, it says that these funds will be used to fund critical resources in response to the surge in API hate, as well as address the long-standing racial inequities that have harmed the API community for generations. It goes on to say that the 5 million out of the 166 will be used to support a peer social network of Asian Pacific Islanders to connect with and support each other through the use of social media. I believe it should be made more clear to the commission and the public that this is the purpose of these funds. And just as important, that the project administered by the OAC is designed to serve this express purpose. As director of RUMCO, I do not often advocate specifically for particular racial ethnic communities or projects, but in this case, the legislative intent was clear. If budget items were sponsored for specific use by any other legislative caucuses, such as the African American, the Black Caucus, or the Latino Caucus for their respective communities, I would support those as well. It was only when I saw the material for today's meetings a few days ago that I realized this project was funded by the API equity budget. I attended the last meeting of the Anti-Bullying Committee, and although mentioned in a sentence or two, the materials and the content in the meeting itself did not reflect that the project was specific to the bullying due to race, ethnicity, or country of origin, let alone targeting API youth. For example, the project visual that was shown and proposed only had white youth illustrated, not youth of color. Was the research based on youth who are predominantly from the API community? It is unclear. Where the program should, of course, not exclude anyone. It should focus on API Islander peers. And again, this is not clear. Nothing in Proposition 209 prohibits or restricts the state from bona fide public issues pertaining to discrete communities based on race, ethnicity, or sexual preference or identity. Consequently, the state can and does issue solicitations and contracts that target particular communities.
Thank you, Stacey. Your 2 minutes are up. Please wrap up.
At the very least, RUMCO believes that the contractors associated with this project be from the API community or have extensive experience working with the API community. So far, I do not believe this has been the case, and for these reasons, we do not yet support this motion. Thank you.
Thank you, Stacey.
Okay, Pashi, your line is open. You may go ahead.
Hi, Pashi Walker, pronouns are Z0Zers. First, I want to echo Stacey Hiramoto's comments. I won't repeat them. I will, however, quote that in the legislation itself, it says that this there's supposed to be an emphasis on students in kindergarten and grades 1 to 12. In all the meeting materials, including the Program 11 survey results, there is no mention of strategies for younger youth, particularly children in kindergarten through 6th grade. There is also no mention of the very real and greater impact on BIPOC or API youth when racist bullying intersects with misogynistic, anti-LGBTQ and body shaming bullying, although there is research to show that doubles, triples, whatever the impact. Also in Program 11's lit review that they presented to the committee, there is actually a statement from a peer-reviewed literature that says interventions with an in-person element with a professional peer or parent were associated with greater effectiveness, adherence, and lower dropout than fully automatized or self-administered innovations or interventions. So should the bulk of the funding go to social media, with the least amount of funding going to the peer-to-peer intervention that this research would show would be more effective? There's confusion by the committee members as to who this program should actually be for. And then there was the mention about the digital divide, which is very, very real, especially when you're talking about children. How many kindergartners are on social media where parents let them just roam the internet? This issue of the digital divide has also been shown as a huge barrier when it comes to the Help at Hand project. I would ask, why the rushed timeline? Yes, I know it says October 31st, but I believe the MHSOAC could go back to the legislature and the API caucus and state that there's a need for a longer timeline when there is so much uncertainty as to which direction this project should go in. At the very least, $5 million will be spent on a well-intentioned, albeit ineffective initiative. But far more concerning is the potential for harm to youth as we appear to address their needs, but actually do not. This includes the awarding of no bid contracts and the lack of transparency regarding who is funded and why have those from marginalized CBOs, particularly as Stacy mentioned, those from the API communities, have not been given real access to these funds. I would urge and request that the commissioners rethink this proposal and not vote to allow for sole sourced funding to happen prior to the January meeting. Thank you very much.
Thank you, Pashi.
Next, we have Laurel. Your line is open. You may go ahead.
Good morning again. It's still Laurel Ben Hamida from Muslim American Society Social Services Foundations. And by the way, we are one of the implementation pilot projects for API for the California Reducing Disparities Phase 2 projects, 5-year and now renewed projects. So a couple of concerns that Stacy and Pashi have brought up are important to think about and consider. I just wanted to say that, yeah, the screen time issues are a big thing for parents, and a lot of kids are tired of screen time after last year. There is limited access with younger kids and economically, depending on how much money is in the home. Parents and children may prefer human person-to-person contact rather than social media, especially post-bullying. So many racial, ethnic, religious, and linguistic groups have been victims of and traumatized by electronic surveillance and bullying. And so I would suggest extreme caution with any vendors that are used. What is their history? Have they been involved in surveillance in the US, Asia, other overseas parts of the world, such as India and Myanmar? And I refer you to the Facebook papers and the Pegasus papers. Thank you.
Thank you.
Phone number ending in 718. Your line is open. You may go ahead.
Hi, this is Steve Leone. Can you hear me?
Yes, we can. It's low, Steve, but if you could speak up a little louder, we can hear you.
I'll try my best. I have to shout. It's bad equipment I have right now. Steve Leone, consumer and advocate with many years experience. I first of all want to note and support Stacy's comments, but on the other hand, I have to say that just as in general principle, I don't see how you could do this with only that audience or that purpose. I mean, if you do it well, you will cover that audience and that purpose if you reach everyone, but I don't see how you could narrow it down. And speaking as a white boy who has personal lived experience as a kid with a lot of bullying, it hurts anyway, you know, whatever the cause of it. And I wanted to move on from there and say that hopefully you're going to, and I forgot the rest of my comment, but I'll leave that at that for now. And thank you so much.
Thank you, Steve.
Steve, your line is open. You may go ahead.
Okay. Can you guys hear me okay?
Yes.
First, I just want to say that I love a child that supports their mother by giving shout outs in public. That's my first thing. I don't know enough about this specific project to get into the details of it like I would normally get into details. But if the law states what Stacy has stated, then that what might change how you would reflect the focus of it, which might be to tighten down all the API communities across the state and link them all into a much more powerful unit to support children. What I was going to talk about was, I think there's an opportunity, which I've talked to Toby about, I've talked to the California Behavioral Health Planning Commission about, and yet don't have any clear indication of doing it, is that the commissioners make a direct request to the California Behavioral Health Planning Commission and a direct request to the behavioral health boards in the 59 counties to collect data to support your initiatives. There's 59 behavioral health care agencies and 59 board of supervisors have really neutered a lot of the local boards, and without tightening down what is in the law, it makes it very difficult to get anything done at a local level. The beauty of doing this is you could give us assignments that will fill out the local elements of what you're trying to accomplish. So intentionally, I think it'd be very important, the 5 million. One comment I had made at one of the meetings I attended was there's a lot of unspent MHSA money sitting in county con in the counties, particularly larger counties. And you can leverage that money for this project. And you might need to intentionally determine what you can't afford to pay for, but what is needed. And so then they can go in and, like Orange County where I live, we could put 500,000 into an anti-bullying effort because we already do anti-bullying stuff as part of MHSA funding, but we could maybe be more intentional about it. Or we also could start to link up the different powers and communities across the state to make them all more influential to help families and children, which is my focus, which is families, because I live the journey and all of our relationships are restored. So I feel very lucky and I like to give that gift to others as well. So with that, it'd be helpful to think, I don't think anybody was against the idea, but nobody's moving very quickly to tighten down what you already have in place, because we have our own little silos and that affects families, and not all families make it through these journeys intact. Not everybody makes it through these journeys alive, or they don't always make it through living the best quality of life they can, because the journeys take an incredible toll.
Please wrap up.
That's it. Thank you very much.
Thank you, Steve.
We had 2 more public commenters come in after the last one. Do you want to take them?
Yes, let's go ahead.
Okay. Craig, your line is open. You may go ahead.
Commissioners, my whole 2 websites for all is social, emotional, positive, G from scratch. And you'll find that my first beginning was bullying. You'll find when you open the ORG, it's about puppies and nonverbal communication of a girl hugging. Let's take it for what it is. The separation of the family and the distance is under the suggestively a resolution. Please write this down to the pleasure of the commission. It's HR 28, July 15, 2015. Section 233.5, part of the Hate Violence Prevention Act, and Section 604.2. The Education Court requires instruction in kindergarten to 1 to 12 to assist to promote encourage kindness and pets and human animals. There was a section whereas human education programs seek to prevent violence by teaching empathy, compassion, respect for all living beings, and help and develop caring, responsible citizens, and so forth. Commissioners, I'm out in the field, Sacramento, Congress. I'm in the field with school boards, and I've been told by a legal department of the county of a city or school district, if it ain't law, it ain't going to happen. And that's their attitude with the constitutional separate government. Even I warned them about a child with blue light for a school district refused to do something. You have to understand, I agree with Steve, there is a problem with, I can't reach the board of supervisors in preventing child abuse for blue light and screen time. This is for the money is sitting in our laws of our Sacramento. Please look at this quickly. Write it down, AB 272, 19, hygiene study about technology in schools can ban cell phones. We were warned then about the technology, and we haven't yet to put Sacramento on the mission of Utah. I would encourage you, this subcommittee, and the interested party about the research, it's all there on my website and the blog. We just haven't, with the testimony of the Congress and the first and the second, I encourage you to listen to it, because my website will take you to the fact we're not a society dialed in as an ethical or moral value of the children. I hate to be this blunt, but that's 5 years and trying to do something that the research is there. And I like to work with your commission and your children, and maybe our legislation will say, well, we wrote bills, and well, wait, next year, we need emergency action, all of us. Otherwise, according to Hagen and the Senate, that will lose a generation over it, and they want their preteen to be addicted to tobacco. That's where you are in reality 101, and I hope you will work with me, because it's sad that we put our kids on the Federal Child Abuse Act and state, and we continue to flourish looking for the answers. I hope your commission and your staff will work with me, because we need emergency action, no joke. And I'm very concerned about, as a grandfather, why we couldn't flourish what Utah has already done, digital health and safe technology in the PTA. When it has disrupted child, I hope you'll bring that to PTA and put schools responsible for their actions.
Thank you, Craig. Your time is up. Please wrap up.
I just want to encourage you, my social, emotional, positive G, please use it for the pleasure of the commission and staff. My number is 714-321-8238. I'd love to get this on the hot radar of the governor. He has my work. I hope we can do something noble. Thank you.
Craig.
Okay, Sophie, your line is open. You may go ahead.
Hi, I just wanted to voice my support for this action because as a youth, I know how important social media is and how important it is to get support through social media. And I know that a lot of people are against using social media, but even though it might be bad and it is harmful to teenagers, we have to utilize the fact that people all over the world are going to be on social media, and it's a platform that's very popular. And it's not something that we can change, that people are going to use the internet, are going to use social media, even if it is detrimental to them. So we just really need to use that to our advantage, which I think with this proposal we are. And even if it's online, like I have personal experiences with bullying and with racial, hate comments and stuff. And it happened like on social media, but that didn't change the fact that I was on it 24/7. And if I had that support on social media, I think I would have been a lot better than I was before. And the fact that not only is it going to be on social media, but there's also going to be like therapists and actual help and actual people that are trained to deal with this type of stuff. In combination with that and the platform that we're using, I think that it would be very effective as a youth and as someone who has experience. Thank you.
Thank you, Sophie.
And then our last public comment, Avery, you may go ahead.
Hi, my name is Avery Hula Vicente. My pronouns are she, her, and hers. I am the advocacy coordinator for the LEAD program of CAMPRO. I would like to echo what Stacy Hiramoto and Pashi Walker commented earlier regarding this agenda item. I'd also like to point out that if the intention is to address API bullying, there's no way it could be a blanket way of addressing bullying, including marginalized communities. There's been specific attacks on the API community, and if you are to explore the actual needs of the API community, there's an incredible lack of support specific to language barriers, the immigrant experience, the intergenerational needs, the multi-generational family households, and culturally competent and culturally sensitive care. So me being a first-generation Filipina immigrant with lived experience and a consumer of mental health needs, growing up in a large Filipino community in Stockton, there's a huge lack of resources for the API youth then and even now. And as someone who actually sought out those services because I had the resources to actually look for those services, including health insurance, transportation, I felt silenced and further marginalized when I entered these quote unquote general youth spaces. So if we're going to be doing this right, highlight the API experience, highlight the API youth, showcase the needs, and show images of API youth in social media. The API community is huge. It's more than just API, Hmong, Filipino, Chinese, Japanese, Samoan, Tongan. This list is huge. So I request that the intention is refocused on supporting the API community if that's what these funds were intended for. Thank you.
Thank you. Thank you, Avery. We conclude then with our public comment. I would ask Cody, please, if you could put up the motion. Are there any other additional comments or questions from our commissioners? I
This
see
is
none.
Commissioner.
I'm sorry, please, Commissioner Mitchell.
Yeah. To, you know, some of the comments regarding the intentionality of this, being for API individuals. You know, if this were a social media strategy aimed at particularly African-American youth, you know, we would, at least for myself, I would be very vocal and in support of that. Absolutely. I mean, we are talking strategies to stop bullying, and we know what has been going on, you know, in the last year with the Asian American community. So I do agree that whatever contract is entered into to provide this service, this social media strategy, it should be very clear that the contractor, that those involved with this contract should have skill, experience, ability to reach this community. So I don't know if that language can be carved out or included in this motion, but I absolutely agree with the speakers that if this is the intention, and considering this was authored in collaboration with the Asian Americans within our legislature, then that was the intent. And I think we have to honor that.
Thank you, Commissioner Mitchell.
So I guess my question is, can this motion be amended to include that those individuals who have experience with the API community be included or intentionally sought out to provide, you know, in this contract? And
Yes.
Someone else, you know, our attorney can help clean up the language.
Help us wordsmith that. Yes.
Excuse me, may I speak? It may be sufficient to say that the contractors shall, you know, the demonstrated expertise. The contractors shall also demonstrate expertise in outreach to the Asian Pacific Islander community. Just add a final sentence.
So, Madam Chair, I just want to clarify that the primary element of the motion is to authorize the commission chair and the chair of the advisory committee on this project to approve the final contracts. So the motion does include, you know, considerable language in there on expertise. What that actually looks like would be articulated in the contracts that would be presented to the commission chair and Commissioner Chen as the committee chair. Again, the purpose of having this on the agenda today is so that we can move quickly and not have to bring it back, not have to wait until the end of January to bring it back. And so what we're actually asking is for the full commission to delegate its decision-making authority to the commission chair and Commissioner Chen. And as part of that, it can be clear guidance to the commission chair and Commissioner Chen of what you're looking for. But I just want to reiterate that, you know, the best way we can ensure this is to work with Commissioner Madrigal-Wise and Commissioner Chen to make sure that the contracts that we're entering into are aligned with both our statutory obligations under the budget and the intent of the advice that came from the advisory committee and all of the comments that you've heard today.
Thank you, Toby. So as I understand it, then that's not necessarily what we're speaking to here, right? Here, this is giving us the permission to be able to move forward. However, Commissioner Chen and I will make sure, as Commissioner Mitchell also lifted up and what our community has said, that we want to be intentional in those contracts to make sure that whoever we contract with has that experience and expertise.
Correct.
Okay.
We're staff is asking that we would ask you to ensure that the work we have done is consistent with those values and that direction.
Yes.
Alternatively, we can re-agendize this at the end of January. The concern is that that creates a significant lag. It still takes time after the approval for us to actually get the contracts processed. So the original language was to be in contract October 31st. We're a couple weeks late. We're simply trying to accelerate the process without losing fidelity to the values around youth-driven, culturally competent, social media, access to care, and anti-bullying on a statewide strategy.
Understood. Commissioner Mitchell, did that?
That answers my question.
Okay.
I mean, that's fine. Yes, that's fine.
All right.
I wanted to be clear to our speakers that, you know, we recognize the concern. And I wanted to call that out because I do agree with where, you know, there is some gaps in the presentation. Although it was an excellent presentation, it was not clear regarding the API, the actual focus of this initiative. It was not.
Thank you, Commissioner Mitchell. Yes. I also see Commissioner Rolette, please.
Thank you. I wanted to ask the chair and the committee chair, will you be reporting back, or is it part of the commission's process to report back to the entire commission that the work that you will be approving or overseeing, and again, forgive my appreciation of this, will be encompassing of the concerns that were reflected in the public comment? So again, I'll restate my question. Will the chair and the committee chair, as I understand it, be reporting back to the commission that the things that were reflected in the public comment were or have been advanced or accomplished?
So, Commissioner Rolette, I am learning as well. I would say so that we will be intentional in looking out to make sure that whoever we contract with meet those concerns, or we are addressing those concerns that the public has brought forth. So how we do that, I would ask for the process. And Toby, in that way, I would ask that you please help me.
Yeah, we'd be happy to. So as a matter of practice, you know, all commission contracts are actually publicly available. We maintain an up-to-date list. I think it's updated monthly of all contracts that we enter into. We're working to differentiate between those contracts that were entered into through a sole source process versus a competitive process. And we differentiate between those contracts that were entered into through a public vote of the commission versus something that was not presented publicly, right? Because we enter into contracts below $100,000 that are not subject to a public vote under the commission's rules of procedure. I'm happy to bring back this issue and report out on the final contracts. We're simply trying to accelerate the process in recognition of the urgent nature of the challenge that we're trying to face here.
This is Commissioner Mitchell again. The only reason why I really brought this up is because of, you know, we had a public comment at the very beginning of this meeting, And I did not get the young lady's name. I won't go, back into the total comment, but, she did have some, in my listening, some concerns regarding the Help at Hand app contract. And so that's really kind of what is leading and guiding my thoughts on this discussion. And so I can loop back to that perhaps later, but that her comments really are what's driving my my thinking as well.
Thank you, Commissioner Mitchell. Any further discussion or question or comment from our commissioners?
Chair, I'd like to move to advance the proposed motion as we see it on the screen.
Thank you, Commissioner Alvarez. Thank you, Commissioner Alvarez. Thank you, Commissioner Mitchell. At this time, Council, I would ask that you take roll.
Yes, I will proceed. Commissioner Alvarez.
Aye.
Commissioner Bontrager.
Aye.
Commissioner Boyd. Commissioner Brown. Commissioner Bunch. Commissioner Carnavale.
Yes.
Commissioner Carrillo. Commissioner Chen.
Aye.
Thank you. Commissioner Cortese. Commissioner Danovich. Commissioner Gordon.
Aye.
Commissioner Mitchell.
Approved.
Commissioner Rolette.
Abstain.
Commissioner Tamplin.
Aye.
Commissioner Wooten. Acting Chair Madrigal-Weiss.
Approve.
The motion passes.
Thank you. Thank you, commissioners. Thank you, everybody, for your comments and providing insight to everything we are doing here today. At this time, I would like to say that we are coming to an end. Again, thank you for your patience with me today. I want to recognize that former Commissioner Chair Lynn Ashbeck made this look easy, and it is not. Thank you so much for your patience. I want to congratulate Commissioners Rolette and Bontrager for getting through this first meeting and being very gracious and watching me fumble. So I hope to see you someday in the near future in person. With that, the meeting is adjourned. Wishing you happy holidays. Take care of yourselves and have a great rest of your day. Bye, everyone.